All right, everyone. It is now 1 o'clock. The meeting will now come to order. The next item of business is standing council members' reports. Please refer to the reports in your packet. Our first report is from the Bureau of Health Services Financing, Medicaid. The chair recognizes Mr. Brian Bennett for the report.
Hi, everybody. My report is the blue one in your folder. And for this update, I'm just going to go over first chapter reports. Okay. And then if y'all have any questions about anything, feel free to ask. For the Beneficiary Advisory Council, that's something that I provided an update on last time when we were in the planning stages. We put out a call for application during the month of April. We got 72 applications, so we did get a fairly good response from that. We selected the members for that committee, and they had their first meeting on July the 9th. And this committee, it represents ideally the entire Medicaid population, but we did, when selecting the members, we did make a point to get representatives from the OAS, OCD, and OBH populations, as well as just general Medicaid members. So that committee consists of Medicaid members, their family members, and caregivers. And they will be meeting every quarter going forward. They'll discuss various topics like potential changes to covered benefits, their experience with the eligibility and renewal process. They'll feed recommendations up to our larger Medicaid Advisory Committee. It'll be a way for our members and their family members to directly engage with Medicaid, so that we can hear that feedback and consider when we're making policy changes in the future, or we're getting ready to implement new activities or programs. House Bill 624. So this is going to be one of the bigger initiatives for Medicaid, not only for this year, but in the next 2 years. House Bill 624 transferred certain family support programs from the Department of Children and Family Services to LDH. One of the biggest ones, the SNAP program, will be coming into Medicaid effective October the 1st. So that will be a very long transition. So the first thing that's going to happen on October 1st is just kind of a behind the scenes transition. So the staff that will be transferring over into Medicaid on October the 1st. So it's basically just human resources and personnel transitions. As far as any public facing effects, that won't happen just yet. So wherever you went to previously to apply for SNAP, that will still stay the same. So all the public facing activities like the application process and any of the physical locations throughout the state, those are going to be the same for now. The ultimate goal is to try to combine Medicaid eligibility with SNAP eligibilities, because a lot of our Medicaid population also receives SNAP benefits. So the ultimate goal is to kind of have a one-stop shop so that someone can go in and apply for SNAP benefits at the same time as Medicaid, so that they don't have to go to 2 different entities. We also hope to, in the future, integrate our systems so that we'll have one system that will cover both programs. But like I said, that's more long-term future plans. Just what will happen October 1st is that those DCFS staff that currently work within the SNAP program, they will be coming over to Medicaid on October 1st. On the next page, there are 2 updates to some of our eligibility programs. The first, the Medicaid purchase plan, or it's also known as the Medicaid buy-in program. This provides an opportunity to allow individuals with disabilities who work to gain access to Medicaid. So changes with this program that went into effect on July 13th, both the income and the resource limits for the program increased. So an individual could make a higher income and have and retain additional resources and still qualify for the program. This program is for individuals that are 16 up to 65 years of age. And depending on how much income you have, there may be a premium assessed on a sliding scale. But the key takeaways from this is that the income and resource limits for the program were increased effective July 13th. For the personal needs allowance and also there's an optional state supplement. These are stipends for individuals living in long-term care facilities. So when an individual goes into a long-term care facility that's funded by Medicaid, they get to keep a certain amount of their income that's reserved for personal care needs, I guess. Typically, those are used to purchase like toiletries, to get a haircut, to purchase snacks for the individual. So effective July 1st, the amounts for both the personal care needs allowance and the optional state supplement increased. The personal care needs allowance increased from $38 to $45 a month, and then the state supplement increased from $8 to $15 a month. Our pharmacy benefit manager transition, or PBM. So in this, I want to start this off by saying this only affects those that receive all of their benefits under an MCO. If someone's enrolled in fee-for-service or legacy Medicaid, this does not affect them. But effective October 1st, we're going to be moving from a single pharmacy benefit manager, moving back to where each managed care plan contracts with their own pharmacy benefit manager. From a service perspective and coverage perspective, it shouldn't affect anything. The coverage remains the same. You might get a different card, depending on who your managed care plan contracts with. So you might get an updated card mailed to you. And then also there's a possibility that with the change in the pharmacy benefit managers, that the pharmacy that you use may be out of network. And if that happens, the plan will contact you and notify you and help you select another. But that's coming up on October 1st. And again, that only affects those individuals that get all of their Medicaid benefits under an MCO or health plan. If you're in legacy or fee-for-service Medicaid, that will not affect you. Two quick updates on our justice involved initiatives. I've been speaking about these for a few months, almost a year now. For our 1115 reentry demonstration, we filed an application with CMS to give pre-release Medicaid coverage to adults who are incarcerated, so that up to 90 days before they're released from incarceration, we go ahead and sign them up for Medicaid. They have access to limited benefits while they're incarcerated. But really the point of that is to make sure that they're covered coming out, that they have their services arranged. They're going to get case management to make sure that all of their Medicaid services or any needs that they have are identified. And that continuity of care is kind of, there's a warm handoff between what they were receiving while they were incarcerated and then what they'll be able to get when they're back in the community. So the update on this, the application is still pending with CMS. They haven't been able to give us a date at this time when they are going to complete their approval on it, so we're kind of in a holding pattern on this one. The second one, though, the Appropriations Act 5121 Youth Reentry Program, that's kind of the same thing, but it's focusing on youth. So it's children and youth up to the age of, I think it's through their 20th birthday. And then also it includes former foster care. We did implement this on July 1st. So we started receiving referrals from some of the facilities in the state. Right now, those that are participating are the Office of Juvenile Justice Facilities, and we have one local facility in the Florida Parishes area that's also participating. But the youth that are incarcerated and that get coverage under this program, it's very similar. They'll get Medicaid coverage, but for this one, it's 30 days prior to their release, and they'll get case management or support coordination. So that support coordinator will make contact with them, kind of do a very, I don't want to say quick, but they'll do an assessment plan of care while they're still incarcerated to talk with the staff at the facility to see what their current needs are, what services they're currently getting, and then also make arrangements for services once they're released. One more update that I want to share with you all that's not in your packet, I did make it into the report, is our Healthy Louisiana open enrollment period with our MCOs. So every year, we have what's called open enrollment with your health plan. So you have an opportunity to change your plan if you would like. For this year, open enrollment will start October 15th and go through December 1st. So we sent out our announcements letters for this beginning, I believe it was at the beginning of this week or late last week. So we're rolling out now. There's a good chance that a lot of Medicaid members have already received them. And that's just kind of announcing the open enrollment period and explaining what it is. And then we're going to be doing a second mailing closer to the start of open enrollment that will go out later in August. And that's my update. Anybody have any questions? Yes.
You say the SNAP benefits will merging with Medicaid?
Yes, well, the Medicaid will begin administering the SNAP program as a result of House Bill 624, yes.
And so how that would affect the disabled that with, let me get my words right. How would that affect the disabled that don't have somebody to assist them and you just doing this straight merge over? Can they come in your office and sit down? Would they have a caseworker that would sit down with them? Because that's a concern to me, because a lot of people that live on their own that's disabled don't understand some of this paperwork, and you saying right now it's a one-stop shop.
Well, not quite yet. So what will happen on October 1st is just, and this is kind of just more of a behind the scenes, it really won't affect the public at this point. Those staff are going to be moving over from the Department of Children and Family Services to the Department of Health. All of those physical locations that you could normally go to apply for SNAP and talk to a caseworker, those will still be there. Those caseworkers will still be there, so that's not going to change.
Okay.
The long-term goal is to kind of incorporate both Medicaid into SNAP. So if you were to go to an office to apply for SNAP benefits, at that very same office, you would ask questions about your Medicaid or fill out your renewal application or whatever you need to do. So you wouldn't have to make 2 trips or make another phone call, take care of your Medicaid, you can do both of those at one place. And hopefully by one work. Or
My
one piece
concern,
work.
yeah, I understand what you're saying, but my concern is a lot of people that's disabled, and I'm just speaking in general, everybody. It's a point where it's getting to where you can't trust nobody. You get phone calls and say, okay, this is this, and they sit in one way. And they can't trust, and then they got people, so to speak, boy, what I'm trying to say, they got people that reads their mail, and then they don't understand it. And then they get cut off for some of their programs, and they might be homeless, they might be something where they can't understand it, and then I feel like that's gonna push the people out on the street, if I'm making any sense, because they're not understanding that. I think, yeah, I think it should be more training where they understand. Do you understand what I'm kind of saying to you?
Can I add to this a little bit? Because I actually had this same legislation also in my update, because this legislation was over 100 pages. So it's very complex. And at the beginning, all of these programs are actually going to come to the workforce. And then at some point, some programs ended up going to the Department of Health. But I think the primary goal at the end of the day is that there will be a one door, it's called a one door to work. And you'll be able to get your SNAP benefits, your Medicaid, and also your employment services all in one area, which I'm guessing the one stops, which are the American Jobs Act. Is that your understanding?
I don't know that part yet.
Okay, and like I said, this bill it started where everything was going from the Department of Children and Family Services.
There was
To-
file.
Correct, but my understanding is because SNAP ENT, which is SNAP Employment and Training, is coming to workforce. So I think they're supposed to be combining all these things so that there's a caseworker that can help you completely with your Medicaid, with your SNAP, with your employment, with any other public services that you need. I think that's the goal of the bill. Now, to get to that point,
And that's why the plans right now, I think, are there's not a lot of detail with it, because there's still a lot of decisions to be made around how are we going to do this so that it really does what it intends to do.
Okay, I understand that part. But right now, you're saying that's gonna be a while, but my thing is, we got a problem with caseworkers overload right now, where they not getting paid enough to do this, and then they merge all this together. And we don't have enough people trained for what they sitting at now.
So. That'll be, I don't want to speak on behalf of our leadership, because again, some of these decisions haven't been made, but. What I think will happen is by combining all of those caseworkers, it'll make the process more efficient so that their numbers can go down, because they're handling 3 different programs, but the volume that they'll have to work with will go down. I think,
that's mine.
yeah.
And I have one more thing, if y'all don't mind, board. Another thing I'm concerned about, and I see, we getting people set up out the prison, we making sure they straight, making sure they get Medicaid, we making sure they get the things that they need once they get out. But what's happening to the people in the Navy, in the Army, the people that's going fight for things that we can have the freedom and they're not getting the service? What is being done for them?
There's a separate, I mean, I don't know if it's, you're talking about active duty military or if
For
there's.
veterans.
Yeah,
So that would be the governor's office of veterans, like, there's a separate an agency for that would handle that entirely. So that's Veterans Affairs.
I understand, but what is being done for them, cause they can come home fighting.
I don't know if that's a question he can answer is my point.
And Workforce also has a veterans program
Yeah.
as well. A case managed to help these veterans when they.
Any other questions for Wanda?
Thanks.
Hey, about the pharmacy benefits management program. So for children and youth with special health care needs, a lot of times when they switch plans, prior to them going to a single formulary, they had issues with like prior authorization. So if they moved to an different insurer, they would have issues, have to resubmit prior auth. Will there be any crossover? Like if they did move, say, from Humana to Healthy Blue, will those prior auths at least be good for a certain number of days? And I was just wondering the thoughts behind moving to different PBMs.
So, Dr. Garabecchio, I will confirm that with you, but I'm pretty sure I have this on notes. The transition will cover or make sure that our authorizations, claims, and coverages will transition over with this, but I will confirm.
Thank you very much.
Any other questions, Evan?
I have a couple of questions for him. And I mean, my concerns are gonna come from the reconciliation bill that was just made. So I know that there's gonna be some new requirements like eligibility determination. So I, just for the council's sake, how often are people gonna have to redetermine eligibility?
I can go over some of those.
Yes. Go over some of those.
Some of the ones that, because there's a ton of provisions and requirements and it's the federal HB one, one big beautiful bill, the reconciliation bill. So one of the major ones is community engagement requirements, or a lot of people refer to it as work requirements. This will only impact those that are in our adult expansion group. So I think back in 2016 or 2017, Medicaid expanded eligibility to allow people with higher incomes who are working to qualify for Medicaid. So the community engagement or work requirements will only impact that expansion group. And we've run some preliminary numbers, and we believe that's about 16% of the overall Medicaid population. Please don't remind me to those numbers because they probably change day to day. But what this will require is individuals, Medicaid members that are subject to these requirements, they'll have to report at least 80 hours of work, community service, work program. They'll have to be enrolled in a half-time educational program in order to keep their Medicaid benefits. One very, very important point, though, is that there's a long list of individuals in the expansion group that are exempt from those requirements. So individuals with disabilities are exempt. Those that are medically frail are exempt. And I also want to just say that this would only cover adults because it's our adult expansion group. Up to age 65. So if you're a child or if you're 65 or older, this would not apply. Also exempt are pregnant and postpartum women, parents or caregivers for dependents 13 years of age and younger, individuals in treatment and recovery programs for things like alcohol and substance use disorders. And the state can also apply for temporary partnership exemptions. For example, we have hurricanes all the time. So if we were to have a hurricane that impacted the southern part of the state, we can go to CMS and say, we want to temporarily exempt individuals in these parishes because they're recovering from hurricane. So I think most of I definitely don't want to say all, but most of the people receiving waiver and home and community-based services, I believe will be exempt from that requirement. Because most of the people are not in that expansion group, and if they are, they're likely to meet either the disability or medically frail exemption after. CMS is going to release their rule on this next summer, because this goes into effect January 2027. And at that time, they'll give us clear guidance on how we actually define some of these things, and can the state choose how they define these categories, or is CMS going to do that for us? So we'll get more information on this next summer when they issue their interim final rule. In addition to the community engagement requirements, two more things that affect only expansion adults. Because a lot of the policies and provisions that are included in the reconciliation bill target just those that are enrolled in the expansion group. So for the expansion group, they will have more frequent redeterminations or reviews. So right now, everyone's reassessed or redetermined annually. For the expansion group, that will change to every 6 months, starting December or January 2027. The same as like. Another thing for the expansion group is cost sharing requirements that will start on October of 2028. The bill is it appears to give a lot of flexibility to the states and how they define the cost sharing. But the cost sharing will be kind of like a copay for each service that you receive. And the bill states that it has to be more than $0, but less than 35. So I don't believe we've begun looking at what that might be set at yet. That one's a few years down the road, but certain services that would be excluded from the cost sharing requirement, primary care, prenatal care, pediatric services, emergency room visits, and then services provided by certain provider types like federally qualified health centers, rural health clinics, and CCBHCs, and I cannot remember what that stands for, but it's a type of behavioral health. So if you were getting any of those services, there would be no cost sharing requirement for those. And again, that's only for those enrolled in the adult expansion group. So if you're enrolled in a waiver, that would not apply to you. That's the high points. Ebony, you mentioned earlier about changes to state directed payments and our provider taxes. We haven't had a chance to dive into that yet.
Can you tell us what Louisiana's percentage is? What percentage?
I don't know the percentage of revenue. So the percentage of our overall Medicaid budget that's funded by provider taxes. I will say that it's a lot of information and I'm still trying to digest a lot of it, but for the provider taxes, I believe the step down for the allowable percentage goes down over several years. So I think beginning in FY 28, it's set at 5.5%. And then all the way to FY 2032 when it drops to 3.5%. So that is kind of good news that it's a gradual decrease so that if we do need to make any adjustments, it gives us a few years to do that so that we're not all hit at once. And then the state directed payments, this is definitely not an area that I'm super familiar with, but that allows us to make payments to different provider types outside of their rates. I think one area where this is common is payments to hospitals. So the state's abilities to make those supplemental payments to hospitals may be limited or affected in some way. That's why also in the reconciliation bill, they included. I believe it's $50 billion for funding for rural health hospitals. That's to be distributed to states over 5 different years. I'm not exactly sure how that's going to work yet, but there was funding included in the reconciliation bill for rural hospitals because the thought was to try to offset the effects of the state directed payments. They'll include the separate fund that states can use to fund those hospitals. So or they don't have, they're not existing.
Hand raised in the public.
Okay,
Adrian Burton.
go ahead, Adrian.
Hi, sorry. Thank you. I had 2 questions. I wanted to ask how WIC would fit into SNAP, the SNAP EBT Medicaid reallocation or whatever, blending. And then I also wanted to ask if you're in the Medicaid expansion adults, two totally separate things, sorry. Will you still be required to qualify every 6 months if you qualify as I would qualify as a mother of 2 young autistic children. They're ages 4 and 2, and I'm not able to work because I'm taking care of them. I wonder because you're a mom, but I guess it's till they're 14. Am I gonna have to keep qualifying to turn in the paperwork or whatnot? Thank you.
So Adrian, I'll tackle your second question first about
Okay.
the redeterminations. The way I'm reading the bill is you would have to do a redetermination every 6 months if you're in that adult extension group. I think the only for exemptions for that, I think the only ones that are exempted are members of tribes. So any Native Americans, they would be exempted from that. That's the only exemption that I'm seeing for that requirement.
Okay. Thank you. And then the WIC.
For the WIC, I'm not sure the answer to that, if that will be incorporated into this, I guess, one-stop shop also. I haven't heard anything about the WIC program.
Okay, I just because I know WIC brands itself as EBT for the ages 0 to 5, and then pregnant and breastfeeding moms. So I know they we get a WIC EBT card, but it's not EBT. So that's why I was wondering.
I will ask about that.
Thank you.
Any other questions?
We have another hand, Brenda Kosel.
Yes, Ms. Brenda? Go on, Ms. Brenda?
Ms. Brenda, you're muted if you're trying to talk.
Good afternoon.
Afternoon.
I heard at least 2 acronyms. Can we explain it? One was WIC and one was whatever the agency person said. Thank you.
I apologize if we use acronyms. So WIC is it stands for the Women and Infant Children's Program. So that's under the Office of Public Health, is that right, Dr. Fairvecchio?
Yes, it is.
It's a federally
Yeah.
funded program that supports mothers and young children with nutrition assistance, I think, and various things. Don't, Ms. Brenda, do you remember what the other acronym was?
It was kind of long. I couldn't even write it down.
Was it SNAP? Was it that one?
No. You said you wasn't sure what it stood for.
You see some
Oh,
out.
Can somebody research that and let us know? We're trying to find out if some of these categories apply to us or somebody we know. Thank you.
Miss Brenda, I just looked it up. It stands for Certified Community Behavioral Health Alliance.
Thank you.
Any other questions? All right, thank you, Brian. The next, I'm sorry, hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Department of Education. The chair recognizes Meredith Jordan for her report.
Thank you. So a couple of things, I won't be too lengthy today. But I do want to start, and I like to include visuals for y'all. So next time, now that I have our latest LEAP data, I'll include some visuals on my next report. But just to voice over our students with disabilities this year on LEAP 2025, we just got all of our latest scores between the last time we met and today. Our kids with disabilities improved their mastery rates again by 1% across the board in 3 through high school. So again, 4 years now of increased mastery rates every single year on LEAP for our kids with disabilities. We're certainly not where we want to be. We have a long way to go. There's a lot more that I want to do for our kids in our state, but really, really incredible progress. And I have at SEEP and everywhere I go, I presented to the governor's office at their last council and give all of that credit to all of our stakeholders, our educators, our leaders, support staff, all of our community members, all of us sitting around this table are the people who are helping move all of this forward and really helping impact our kids with every single step, intentional step that we take in our state. And I'll just say, if you remember, so last year, our kids with disabilities outperformed their non-disabled peers across the board in 3 through high school. So last year, we took a 1% little hunk out of the achievement gap between kids with disabilities and their non-disabled peers. This year, their non-disabled peers, so regular ed students in 3 through 8 also grew, but our kids with disabilities in high school outperformed their non-disabled peers again. So really, really incredible things. I'm so proud of our students, their parents, and all of our community, and everybody who's really rallied around to say, what do we need to do to make sure? I've said this so many times that I truly believe, 5 years ago, 10 years ago, we were saying that we were including all kids and making sure they had access to high quality teaching and learning, and we were not there. We are well on our way there. Do I think we have arrived, ever will arrive? I hope we are not there completely, but so many steps forward that we have all worked together to take is getting us there. So I'll include those visuals with y'all next time. And I'll also bring next time, nothing has been released publicly, but they should by then, our annual performance report. I would love to share that with you guys as well. Again, the best annual performance report that we've ever submitted. And it's all of our work coming together. So really, really proud of them and wanted to share that LEAP score update with y'all. So first thing on my report, SEEP next meets on June 18th. We next meet September the 4th. We met in June, covered all of the legislative policy bulletins that we really talked about a lot yesterday in education and employment. So I won't rehash all of that. But I do want to reiterate, we had a great conversation yesterday about the differences in the trainings that we're gonna roll out, in response to Act 479, and had somebody ask, can you go over that one more time? So we have a little training and what we're calling a big training. Big training is we're gonna release statewide access to behavior de-escalation training. It's gonna help our young students. I had a conversation with our early childhood team who felt like, yes, let's also open it up to our early childhood lead agencies and early interventionists who are supporting those kids. And then, of course, educators and leaders in all of our school systems. So we will have that, what I call big training, that's gonna go statewide. And should impact a lot of educators, a lot of kids, and provide a lot of supports. That then helps them access the very education that's gonna get us improved results. So it's super important, and a super win in this legislation. What I call the little training is a much more focused group of people who will receive, CPI training. Anyone who's on a crisis intervention team, that may support students with some of these real severe behavior challenges, that are part of their disability they can't control, but our educators need to know how to properly support those students if they are going to use any physical restraint techniques. And so we will target that training to folks who are on crisis teams, the people who really need and are called upon and support those kids who may encounter and have those challenges and need those techniques. Should be rare, but want to make sure that people in the field, legislation now requires anybody doing that must be trained. And so we are hoping to roll that out this fall. We're already in communication with the vendor so that as soon as our purchasing system opens, we can move that forward and get those trainings going. So I just wanted to clarify those one more time. I feel like teacher leader has been, so much has happened since teacher leader, but we just had teacher leader in June. And I did want to bring everybody, we had some extras and I thought about you guys, wanted to bring you all a shirt. So wanted to make sure everybody got one. We've also been at a couple of other events and partnering with a couple of other agencies over the summer. So we presented at our Louisiana Association of Special Education Administrators Conference that brings together, it's an independent organization outside of the department, and it brings together special educators, supervisors, and leaders from across our state. They also this summer received accreditation, which is really exciting. They received accreditation and official support from the National CASE Conference, which is a national organization that supports special education leaders, that will help to also grow our special education leaders and supervisors. So that was a great recognition for them at that conference. We did a lot of, they invited us, my team, we did a lot of presentations to special education supervisors and directors there. I also wanted to include in this report some of our summer grab and go activities for literacy and math that are helpful for parents and guardians who, as you may want to do some of these, support your students over the summer. So I wanted to include those. I try to share those with y'all each summer. They're printable. We do have them translated. If there's anything that y'all need with those, just let me know. This next update is really exciting. So the sensory regulation adaptive materials update that I included, we often, and Steve talks about this a lot, how we use the more state funds, our state IDA set aside funds that we get. I like to give most of those back to our school systems, whether that's through materials they need, supplies, initiatives, professional development. One of the things that we decided to do with some of our targeted funds to support our youngest children with disabilities was we surveyed our early child care centers, our lead agency networks for our young children with disabilities. What are some things that you need? Because we don't get a ton of money. I get more money for our our 5 through 21-year-olds, right? Because we have more of them. Our 3 through 5-year-olds for us don't generate a lot of money. Our school systems don't get a lot of money to support them because it's a small population of kids. So we took some of our dollars, asked our early childhood support organizations, and early childcare centers and said, what do you need? What do you need to support behavior? What do you need to help our youngest children access literacy, access math, so that they're ready when they get to school? And so I just kind of gave y'all some of the numbers here and some of the things that they, adaptive materials, that they requested, we purchased and we sent out to school systems. They were so thankful, and so excited to get a little bit of joy, this summer before they really kick back off, the typical school year, and getting some of these tangible materials that they need for their kids, but they may not always have the money for. So they get skipped over, right? Well, I've got to buy curriculum. I have to buy some of these things. So I'm not gonna, or educators or early interventionists are using their own money, right? Like we always did as teachers. So that's really exciting. They were very, very thankful for it. And we were happy to do it and happy to use some of our funds to help them. Because I always tell people, just like with our students, if you ask them, they'll tell you what they need. Let's ask our teachers, let's ask our early interventionists, what do you need to better support you in the classroom? And so that was great. We're also offering Reed Hagerty training, which is a curriculum for young children to support literacy, language outcomes. Our lead agencies received the curriculum manuals. So again, making sure that our early interventionists and the folks who are supporting our young children with disabilities have access to high quality curriculum, just like their non-disabled peers. And so again, we use some of our money to get that curriculum out there, to get manuals to early interventionists and teachers who are supporting these kids. We are making a big push at the department around, we've done a lot and it's reflected in our scores around literacy access, numeracy access for our students as well, making sure they have access to high quality intervention. And we have to shift that even earlier. And to our young children with disabilities, making sure they also have access to that high quality intervention and teaching and learning. So this is something we're doing and really focusing in on with our young children with disabilities to make sure they're kindergarten ready when they come to school, that we are trying to close those learning gaps as soon as we can. We have registration open right now. We're offering some additional dyslexia training for educators. Really, we wanted to offer a module for all educators. Anybody who may come into contact or have students with dyslexia in their classroom. So I wanted to share that. We have our next event coming up is going to be our Pupil Appraisal Institute. We are fostering that collaboration with LaCia and planning that Pupil Appraisal Summer Institute. It'll be a 2-day conference this year to support, when I say pupil appraisal, these are our multidisciplinary teams in school systems that are evaluating and identifying students with disabilities, making sure they know how to identify this early, and the importance of getting those evaluations done quickly so that we can provide early intervention. So we have a lot more support happening and coming up in as we kick off the school year. And I'll stop there, and I already see questions.
Just to let some of the early interventionists know that anytime, as y'all know, anytime they put autism or sensory in front of it, it costs a fortune. But Hobby Lobby has weighted animals for $10. I went and bought lunch last night. Like dog. Because usually one animal goes for $50. And I was able to get 8 of them for $90. Oh. So, I don't mind spending $10 or even $100 looking at that many and share with my team.
Even you brought.
And I'll give them away as, to other teachers and stuff for our autism group. But for that $10, that is up to her. it's worth the $10. So can't get them online. They do have them at the stores. I went here and got a bunch. Just to let y'all know, they are available and they are very well made. They do last, but they hold up in my classroom. Vivian?
Hi, are SROs included in the restraint and seclusion bill?
I'm sorry, say it one more time.
Are SROs included in the restraint and seclusion bill?
So if they are employed by the school, they're on the school crisis team, then I would think so. It really depends on, are they school employees, who are they working for, I think would determine, but that's something I can bring back to our legal team and ask too.
Thank you.
Jim?
I have two parts. Number one, always two. So the first was, and I'm gonna have to do this, and I'm gonna need to work again. But there was proof, like, there was straight in seclusion law went from Act what to, went from Bill what to Act what.
684, House Bill 684, Act 479.
Act
479.
479.
Yep.
And has got it,
Starting out as 237, right?
It did.
House Bill
it
2.
did.
Yeah, it got renamed about halfway through the process.
Lovely.
Meredith, how is the retention of sped teachers? How is that looking for our students? Them staying, are they staying, or compared to what it usually was?
So that's a great question. I think our next workforce report either goes to August Bessie or October Bessie. I can better answer what our numbers are. I know that last year, special education was not a top need in our state. Interesting. It's math and history. But that doesn't mean from year to year, right, our workforce needs change. We've done a lot. We actually invested a lot of ESSER money to counteract to some of that, post-pandemic, leaving the classroom, that kind of stuff, and staffing shortages. So we had certified the most new teachers following the pandemic that we had ever. We're also, writing a grant right now that's gonna bring us some additional funds to continue on that trend of let's not get a lot of vacancies supporting our kids with disabilities. I am also very interested in our state in making sure every educator knows how to support a student with a mild, moderate disability. I'm not talking our significant,
Yay.
but every single educator in our state
Needs more than just one sped 300.
is correct. And we're doing that, I'm kind of leading out on that in two ways. So, we're doing the same thing for English learners. So we now have required coursework for every teacher in the state to also be able to support English learners. I'm very interested in, and that's our goal, is to create teacher competencies that all teachers need to support a student with a disability with a mild moderate that walks in their classroom. They're gonna be in every, right? They should be. We want them in general education classrooms. And to make sure that our regular education teachers also have the knowledge, to support that with the consultation, with the support of a special educator, likely if needed. But, I'm really interested in that. We've got a grant in the works, to kind of, that'll help us rethink how we have thought about special education, mild moderate certification, and how do we get all teachers with that knowledge. So give me a few years, right? Like,
Like a dual certificate, like.
Yes.
Certification.
Yeah.
Good question.
Hi, so about mild, moderate, more severe disabilities that can be harmful thinking in terms considering needs fluctuate and change and depending on the situation and everything going on, the disability can present itself differently.
Right.
So we have to remember these things and make sure we don't think too much about putting people in certain boxes.
I totally agree with you. Words absolutely matter. And I tell people all the time, like even our students, who are in that classroom, a more self-contained classroom with a teacher who has that severe significant disability certification, I want them as much as they can to access general education curriculum, to access general education settings. So I think we're definitely on the same page. I think the terminology, and maybe that's something we need to look at too, is the terminology that we use around certification. We do have pretty old terminology, so we have a mild moderate certification pathway for educators. And then we have what's called this old terminology, not Meredith's terminology, severe profound terminology. So we have that pathway, right? So that's those typically the teachers that you see supporting in a self-contained class, with students with multiple disabilities, or severe disability. So I understand, I don't want to put anyone in boxes. I believe least dangerous assumption, we should teach every kid, assume every kid can learn to read, to do math, and all the other supports and skills and life skills that make them need it. I think your comment is certainly well received from me.
The skills that a special education teacher may have may also prove useful for other teachers as well, just in everyday settings.
And speaking of that, Meredith, I just wondered, is there anything in the works for our self-contained teachers being like mentor teachers to other teachers? Like I have to go through some leadership program, you know? I don't necessarily want to be a principal, but I love to help other teachers.
Yeah.
You know, that kind of
I think definitely locally, like that could be a local decision. I think you should start that mentoring program in your school system.
I know.
Right.
It told me.
But yeah, I mean, certainly every actor coming into the workforce, we really value that mentoring piece. Every teacher coming into the workforce needs some partnership, some mentorship and collaboration in their first years, probably at least the first 3 years, right? I mean, I think all of us wish we could go redo our first.
Even if it's just to handle paperwork, I mean, it's a total game changer to know somebody who knows how to coordinate.
Finding out.
Come on. So I'll sign it, you do it. Leo?
Okay. Not related, but I'm collecting really new kids, the pin FYI. But two related questions for these adaptive materials. What was your budget and how much did you spend?
So I can get that for you. I'll work with our early childhood team. We probably spent, I don't want to guess, but we spent a good amount of money on our school system. A lot. I mean, you're looking at
stuff.
Christy, you know how much these things cost.
Yeah, just the liquid towel mat is like $45 for one. And
So we probably spent several $100,000 worth
Yeah.
of.
But it's good stuff. I can vouch that. Amazing.
Now, is that the, okay, nothing more? Okay. Like the 5-year plan and committee is coming up and I just think like it was mentioned earlier, like, I think we need to be more of like a like programs that have like that like include all this and that give materials, like, and then when I went out, why, like, they had so much, just like, not necessarily fidget spinners, but like, on every table had still of like that kind of stuff in partnership, like on the tables and not just like like just I think that this is, I don't want to sound dumb, but this is the future in the business and and I just think there's more of an importance on stuff like this.
I think you are absolutely right, Jill, and I think that's always been my, on this council, what can I bring, right, as a department? How can the council help? Because we have the education piece. And it is this balancing act hard piece because like I get money to do this work, right? What can the council do to also, Ebony's always like, Meredith, what can we do? What more can we do in the education space? And I think that's something we can think about, like moving forward, what are some of the things that the council can also help weigh in, right? Without a direct oversight of our schools, and then I get money to do these things, right? So I take y'all's ideas and then I'm like, all right, I'll go.
I can give you the cheaper version, where you don't have to buy the most expensive version,
Yeah,
just to let you know.
Yeah.
As a teacher, I stretch my budget.
There you go.
Yeah, but I want it to go far.
Oh,
Brooke?
okay, I have one question, concerning the parents in the classroom. I know they're gonna be mandated in February, and I want to know in our meetings leading up to that, February and then thereafter, do we get like a rolling list of what parishes or what
Are compliant?
and what, that are compliant? Yeah, that's just my request. I know it starts in February, but.
No, that's a great, so I'll have the data, I'm collecting it right now on all the purchases for last year. So I'll have the data from this year that I can bring to October.
Okay, yeah, that'd be perfect, and then if we could just keep getting like as it goes on, because I know we had 8 million allocated and
Yeah.
2.2 million has been spent, so it's nice to know what.
Yeah, and just to say though, that money's been sitting there, so it's collecting interest. So they're making some money off of it, the ones who haven't used it yet, just saying. Just saying.
Just so everybody's aware, that becomes effective in February 2026.
Yeah.
If you want your cameras in the classroom, at the beginning of the school year, you got to request them. I just submitted mine this morning.
Let's go start like next week. A good job.
And they all have audio, correct? I don't
Yes,
know.
audio and
And
visual.
visual. Any other questions?
We have a hand raised.
Yeah. Go ahead, please.
Hi, you spoke of educators identifying those with disabilities. I was just wondering, why doesn't a medical diagnosis seem to carry the same weight? I mean, I understand they're assessing for services needed, like what the student might need to succeed in the classroom. But it seems like documenting the medical diagnosis would be helpful all around to the student, especially if the school is willing to take the Medicaid funding, but they don't recognize a diagnosis. For example, my son qualifies for articulation therapy, but is a severe elopement risk. And so without his diagnosis being like honored, it isn't really addressed, you know? Sorry.
Yeah,
Thank you.
so-
Thank you so much.
No, that's a really great question. So we have to align our eligibility criteria to the federal, to IDEA. So IDEA tells us for each exceptionality category, what has to be demonstrated for that student to get that identification. Now, in our state policy, we certainly say, and we just also opened this up to help parents. So our policy will now say, once it's on notice of intent, that any medical or doctor from any state, from the United States, can be considered. Prior to this recent change, it was only a doctor or physician in Louisiana or an adjacent state. So we kind of opened that up for families. So like families coming here from Massachusetts are gonna have to, they would have to go and get a doctor's appointment to somewhere closer, get another. We fixed that piece. So I think to quickly answer the question, the medical should certainly be considered. If there's a student suspected of a disability, according to IDEA, the medical should certainly be considered, brought to the table, discussed. The parent can bring any concern, any documentation to the table that they want to discuss. But then the multidisciplinary team is going to have to use the evaluation criteria to see what other assessments and what else is needed to get that designation of one of the 13 disability categories for IDEA. So it's a little bit, it's not just a doctor's diagnosis. There's other eligibility criteria per IDEA that has to be considered for each of the 13 categories. That helps. Questions?
All right, thank you, Meredith. Hearing no other questions, the report requires no action and will be placed on file. The next item of business is the report from the Disability Rights of Louisiana. The chair recognizes Tori Roca for the report.
Thank you very much. That's the 11-ish working group package. Let's see. But highlights. Program, it's a program that helps people with disabilities apply for services from Louisiana Rehabilitation Services. Currently are assisting 30 people in that program. And coming up in August 13th, we are working on holding a College Employment Conference. I think we passed out flyers. Our community living ombudsman program. Bring advocates who are ombudsmen, advocates for people with developmental disabilities who live in the ICFDs across the state. And 401 of those and 3,920 individuals. In May of this year, the ombudsman for that program visited 132 of those facilities. Received requests for assistance and took action on all in our supported independent living advocacy program. That program serves individuals with developmental disabilities who are receiving waiver services and courts and living in communities. We are currently assisting 32 people with that program. Our REP payee programs, our representative payee program. Protects Social Security beneficiaries, make sure their benefits are being administered appropriately. We have finished 43 cases since the beginning of the REP payee year, which is way back to August 1st of 2024. We are 82% of the way to our target of 52 cases for the year. Currently have 13 other cases in progress. And our FAIR program, which is the Financial Access, Inclusion, and Resources program, provides financial coaching and case management services to assist formerly incarcerated individuals with disabilities, in public areas. We recently reported to the city of New Orleans, because that program only operates in the New Orleans area because that is funded with private grants, so we only have the private grant money to operate in the limited part of the state, unfortunately. We have total 39 active clients, who are Orleans Parish residents. We are over 87% way to reaching our goal of providing people who are case management services to 45 formerly incarcerated Orleans Parish residents with disabilities. Most of the clients have achieved or maintained employment for this period. Most maintain their jobs for over 90 days. And most of the clients increased their income while in the program. And a significant number paid off their debt or paid down their lease since they've been in the program. That's
Any questions for Tori? Any public? I'm sorry.
I just wonder whether you could repeat the date, time, whatever, tell me if just in. Thank you.
Any public comment? Hearing none, the report requires no action.
Karen has a question.
Oh, I'm sorry, thanks, Ben. No, that's okay, go ahead.
The curious, what's the standard? So just what kind of case? Reach out to your organization, and you can provide help, just. All the night.
So, I'm not sure what you're, so specifically, in, one of our ombudsman programs, and which.
Like what kind of issue usually you take care
Say, if people aren't getting, medication, if people aren't, being allowed visitation from family, people aren't being treated properly otherwise. I'm assuming you're talking about if, somebody is living in a residential facility, and we, investigate that. Yeah, so basically, people aren't being treated, appropriately, getting the services they need and supports they need, the medication they need, if they're not, being allowed to see family members, get visitation, all kinds of things like that. So any violation of rights, any lack of services or support they're supposed to be receiving, we will investigate. And we can investigate. And depending on resources.
Yeah, since I heard some bad reputation, bad comments or the home or patient care. I just wondered, so usually the ombudsman, they will go there to check, right? Annually.
Yes.
I'll just
So the ombudsman can go to check specific things. Our legal team can go to check specific things. Say if we get a complaint or something, our legal team can go and then check on the complaint. Our ombudsman can as well. Our legal team sometimes just goes to facilities and just as we're here. We often give a heads up first. Let you know a day or some days in advance. Some facilities either don't know that we are allowed to, that we have access authority to go there, or they act, or sometimes they act like they don't know. And we tell that our legal director is very, she's a nice person, but she'll tell them like, I wasn't asking you, I'm saying we're coming because we have federal authority to go to facilities. So we can go there in response to complaints. We can go to do investigations. With one of our grants, we meet with our federal program officer every month, and she actually asks us to be approved on our own facilities. So we can do it in response to complaints or just proactively on our own.
Any other questions? Gio?
wait. The 2-year FAIR grant are.
Let's see, it looks like January 24th, it looks like.
January 24th.
Yeah, that looks like January of 2024 is when it looks like.
Okay, but when I would, we can show.
Vivian?
So I don't know if this is in your domain or not, but a few months ago, I tried going to the dentist and the dentist refused to examine me because he read my chart and saw it had autism and epilepsy on it, and he told me I would chomp his face off.
That is, something that we can investigate.
Well, thank you.
Check his hands, see if he's got.
I did, I'm not gonna button on.
The chomp off his fingers, I haven't done that today. I haven't even had
You
you
wanted
want
to go after that, that's okay. Now,
She's gonna be good.
oh, yeah, that's the best.
Can you repeat again what the dentist said?
He said I would chomp his fingers off, and then he like this. He was kind of funny about it, not really, like, I thought it was funny because I thought it was absurd, but he was very serious about it. It's a little concerning to me. And then he kept asking if I saw anyone for my, like, autism and epilepsy, and so I started listing off some doctors. He said my neurologist wasn't a real doctor because the name is, like, Mexican. Whatever. The doctor's name is Dr. Shan, and he is Asian.
Wow.
Yeah. It was an experience.
Any other questions? Karen?
Just one more question, just because I heard some kind of situation like a residence, they physical injuries. And they usually attribute it to the fighting or themselves, the second scratching or they themselves attacking Karen. So that kind of thing, if something gonna happen, I just wonder if there's they need a report or need somebody to check that to try to see some change to stop that.
Yeah, if you can provide more details to me about it, we can talk about that, you can give me more details, and I can give it to our intake people.
Because they don't front when they say this situation attributed to themselves because the residents themselves, they're not able to speak, they're not able to protect themselves, so I'm just concerned that that's why we can do something to really help.
Can you be more info about that? I can see if our intake people, I can give to our intake people and can run it by our legal team and see what actually.
Any other questions or concerns? Hearing none, the report requires no action and will be placed on file. Thank you, Mr. Ruffle. The next item of business is the report of the Governor's Office of Disability. The chair recognizes Leo. Yeah, much less. Sorry. Oh, yeah, sorry.
I just want to clarify, with the Governor's Office of Disability Affairs.
Disability affairs, oh, sorry.
It's all right. It's just gotta make sure we get the acronyms right. My Lord's been GOP, I'm gonna do that.
Go to affairs.
Yeah. So thank you all for having me. The main thing that we want to talk about today is web accessibility updates. This is a statewide initiative. This is in response to some pending litigation from the Middle District of District Court of Louisiana. The Department of Justice has issued guidelines for visual accessibility compliance, and basically it states that local and state governments should meet ADA standards and that all. There we go. All boards, commissions, departments, agencies, institutions, and offices of the executive branch shall serve to meet these deadlines, and we have a pretty good list at the bottom here. It's the greenish form, by the way, sorry, not to mention that. We have a pretty good list of deadlines. The current one that we're under is September 30th. It's to submit an action plan identifying steps intended to take and update major web properties in compliance. I believe at this point the first one was back in March of this year, was to designate a web accessibility coordinator. Every entity board, commission, whatever it may be, has to have a web accessibility coordinator in order to meet these deadlines. And so I believe the final day for full compliance is April 24th, 2026, which is a lofty goal, but I think we can absolutely hit it. I think we've done a lot to hit those metrics, and so far things are going pretty smoothly. We're working very closely with Ricky Davi from the Department of Administration, who is our state ADA coordinator, coordinating with their office to ensure that these changes are being implemented in a timely and effective manner. We have some resources that are at the bottom there. If you have any questions, you can always reach out to myself or Jamar. We're happy to coordinate with y'all individually and kind of walk through the process. Because from our perspective, we want to make sure, as the Governor's Office of Disability Affairs, is that we are kind of leading by example, making sure we hit our metrics as well. So we're doing all the same things internally that y'all are doing to meet these standards. So anything we can do to assist, we're happy to do that. We have another thing that we're working on. We had in June, I think this is after our last meeting, we had our first ever disability awareness day at the Capitol. We had about 400 people, I would say, there that day, and about 24 statewide disability agencies, including the DD Council, LDOE was there, and just so many others. But that was in partnership with Split Second Foundation out of New Orleans, and co-hosted with our office, our office and the Advisory Council for Disability Affairs, GACTA. So we were happy to do that, and we are planning for next year. We're still very early stages, getting dates and things like that. It's always dependent on availability and location, especially because we want to keep it during session. And as anyone who's scheduled an event during session, meeting spaces and scheduling availability is at a premium during that time. So we're working very closely to make sure that happens again. It was, I think, a great success. And the last thing I have for this report is our conference, which took place last week. We had 18 presentations and about 36 presenters over the 3-day conference. We had 2 days in person in the Playroom building at the Capitol, and 1 day was fully online. I think it was very successful. And we hope to continue to do a hybrid model next year so we can have more people come in person. And also for all 3 days, have the accessibility that is associated with virtual attendance if necessary. Yeah, I think it was really beneficial, and I think that every year we do it, it's always a great way to interact with the community and kind of figure out what the needs are. So that's what I'm doing. That's the last thing I had. So if anyone has any questions, we'll happily take them.
So go back, I'm kind of confused. What accessibility of who, like, who are we trying to get into compliance?
So that is every, well, let me go back and make sure we make this right. It is all boards, commissions, departments, agencies, and institutions of the Office of State Government. So essentially, if you do anything within state government, you have to be compliant by April of next year. And again, we're working with DOA and Ricky Davi, our state ADA coordinator, to make sure that these individual agencies and boards, we have over 400 boards and commissions, so it's a lot of making sure that they're all compliant, and so it's just we're working on it. But like I said, we're hitting our metrics so far, and we're gonna keep going.
Any other questions from council members? Public?
Yes, 2 questions.
Yeah.
One update on the self-advocate representation on the Governor's Advisory Council on Disability Affairs, and also an update on the number of bills that go to tracking session. I understand historically some advocate representation is robust on GATRA and offices historically have around the perimeter building.
Okay, so I'm trying to break that down. For the representation on GATRA, we have currently 7 members, as you may know. We will work, I don't want to speak to which each individual member is a part of, because as you know, they have different distinctions. Some of them are members of the community at large, some of them are persons with disabilities or family members with disabilities. And so I can get you more information on what the current kind of framework is. And then your second question about, I mean, I would say probably, I mean, we have what, like 1,000 bills, so probably it's usually around 70 to 80, because it just depends on what is the percentage of that deal directly with the disability community. It's usually around that number. Anytime there is, if it's a more specific session, then it will be a little bit more, you know, that number can fluctuate. But for this go around, I think it was around 780 for the safe number. I don't know exactly. I can find that for you and let you know. But yeah, I would say about that.
Of course. It's interesting in self-advocate on that.
Yeah, I will check on that and get back to you. Yes, that's the Governor's Advisory Council on Disability Affairs.
What types of disabilities have representation on GATRA?
So again, it depends on the individual members themselves, whether they have a direct disability or not. But in terms of who we work with, anyone from a public perspective is welcome at any of our meetings to come and speak. We try to advocate for you know, issues that affect all disabilities, you know, equally as much as possible. But if there's anything in particular you would like to bring to our attention, you're always welcome to attend any one of our meetings or reach out to me directly. And I can definitely make sure that gets to the council.
Thank you.
Yeah.
Any other council questions? Public comments? Hearing none, their report requires no action to be placed on file. If there's no objection, the meeting will recess for 10 minutes. Hearing none, we are now at a recess. We will reconvene at 2:41.
had all kinds of questions in your chat on our live Zoom. And it was all deleted. And it was really for you, Mrs. Ebony. I'm a little bit upset that none of you picked up or read my answers. I don't know what happened. I was all set there in the chat room, and it was just disregarded. I don't know what to say. Hello? Yeah.
Good. The meeting will now come to order. The next item of business is a report from the LSU HSC Human Development Center. The chair recognizes Dr. Bill Wilson.
Hey, thank you.
Wait, did I pass? Oh, I'm so sorry. Oh, I'm sorry, Sheree. The recess messed me up. That's okay. I'm sorry. The next item of business is the report of the Governor's Office of Elderly Affairs. The chair recognizes Sherry Crane for the report.
Good afternoon, everybody. It's gonna be pretty short. Just the standard, data that I always provide. Just kind of going over to Elderly Protective Services on the second page. I'm sorry, my report's yellow. The data, the report was due before we have, of course, the end of the year data. Don't have a breakdown, but we have accepted 5,203 cases of elderly protective services for just the year, which is high. We did get the additional positions I did talk about earlier in the year. So now our caseworkers each have less than 50 cases nationwide. Some of them do only have 35. So that allows them to open those cases, investigate, and close those cases much faster. More efficient. We still have a turnover though that we're trying to work out to try and see why we have the turnover. If it's just the nature of the job, which a lot of it is. Some people think they can get in there and they have the love of the elderly, but they cannot deal with what they see, what they have to deal with family members and so forth. So we've started a survey that we give to each of the new employees at 30 days, 60 days, 90 days. And we ask them a variety of questions of, do you think that you're getting the appropriate training? Do you need more training? What do you see as an issue? What are you not getting from your supervisor? Some things like that. And that actually comes to my unit since I work in compliance and planning. And so I look at that and then we do statistical data on it and we look at it, we try and say, okay, what area are they located in the state? Who's the supervisor? Is there a trend here? Is there something I need to go back and train the supervisor aware? So we just started that. So there's not really a lot of data on it to talk about it and how far it goes across the state. But that's something that we'll be looking at and continuing. Just gonna hit over onto the recent news. We had our conference in April, a huge success. We take that once a year and we take directors, new directors, and we kind of start at the bottom and say, okay, what is it that you're having trouble with? What is it that you need more training from us on? Is there anything that you need clarity on the taxonomy, on the services that you're supposed to be providing? Things like that, and we have the breakout sessions. So that was really a huge success. Last year, we also kind of talked about how the federal government had updated our Older Americans Act, which is what we have to be in compliance with by the feds. They finally updated that after about 20 plus years. And so we had to implement some of those changes in our own policy and procedure manual, and we have to be in compliance by October. We took that opportunity at the conference where we updated the manual by that date. We gave it to the directors, asked them for their feedback. A month later, we was like, okay, submit it to us, let's look at it. We had very little feedback. Everything they felt was addressed. We've changed the policy and procedure manual, and we are actually in compliance almost 90%, and we're not even in October. The only other piece that we have in with that is we have what we call the grab and go meals. So if you remember during COVID, it changed everybody's world. And seniors were so used to coming to those centers, sitting down, having a meal, talking, socializing, really couldn't do that anymore. So in order to stay in touch with those seniors, we started allowing them to come pick up the meals through a drive-through kind of situation. So the feds realized that that is helping a lot of seniors that are not so social, but they want to get out, and other scenarios. That's the biggest one. And so what they're allowing now is that they're going to allow the grab-and-go meals to continue. However, the agency that is not mandated, they don't have to do it. If the agency decides to do it, they have to track it because it cannot exceed 25% of the allocation of funding that they get from us for those grab and goes. So they are putting limitation on it so that it's not They still want to have that senior center where they come and socialize and sit down and have a meal. They don't want to just have everybody start to grab and go. So that's kind of the only piece of compliance that we still have left, because we have to amend our state plan to allow the grab and go. Then each agency has to do an area plan, so they have to amend the area plan. And then we have to amend, a couple other things in order to be in compliance. So that's why we're not 100%, but we have to launch it. So if you hear anything about that, that's pretty much the gist of that. Our next board meeting is August 27th. I have the wrong date in there, please excuse that. And then our Old Americans Month was in May, and we always have a theme, and this year was Flip the Script on Aging. So they just have a lot of information on the federal website. You might also hear some talk about ACL and their restructuring and organization. So they are combining their structure with the American Community Living and CMS. And CMS is the new name, it's the new acronym, and please forgive me, I forget what it stands for. I will look it up. Also hurricane season, as everybody knows, started June 1st. It ends November 30th. We've been blessed the last couple of years, thank you. And I'm just hoping that trend continues the rest of this hurricane season. And then the few other things that I wanted to bring up, one is the web accessibility that Leon talked about. Every agency is having to do this. It is a huge undertaking. It hasn't been to this point, but the next benchmark for September 30th, we have to look at every single thing on our website. So those agencies that have had a website for 10 plus years have to look at every single link on there and make sure that it's in compliance. Most of those, if it's a Word document, an Excel document, a PDF, all have to be recreated and or being able to be transformed into a format that is acceptable, where closed captioning is available, as well as voice overlay. So it seems like, oh, it's just easy. No, and unfortunately it's under my department, and so it's me and my other staff member. And it's a lot, especially if you've been a website that has a lot of data and information on it, ours does. Some of them can be exempt if you have certain things. There are some things that can be exempt from being translated into a new format, but we are working on that too. We've met our benchmarks too, which is great. We're ahead of the game, trying to stay ahead of the game. The other thing is I want to just kind of touch bases really quick on legislation. A lot of people are talking about, things that are effective. In House Bill 1, the bill added an allocation for our office for an additional $412,200 for dementia specialist resources at parish and disability resource centers. So our agency has 8 resource centers throughout the state. Don't know what this is going to look like yet, because this is one of those things that I knew somebody that knew somebody and got thrown at the end. And so we're meeting and trying to figure out how that's going to look, what's going to do, what we're actually going to provide. What is the $412,000 going to actually do for our 8 resource centers? So that's something that is on our plate. House Bill 126. This bill really adjusts the funding formula for determining the annual state funding for each council on aging. And so you have those rural areas that, don't have the extra funding, as where you have bigger parishes such as EBR that gets a millage. So it's really hard to determine a overall dollar per senior that each council should get. So this kind of adjusts that and gives them $4 per parish resident over 60 or 150,000. So there's a cap on the ones that do have a bigger senior population that they serve. So this it's hopefully that will help fill those gaps. The gap was when COVID came, they got a lot of additional funding, so they were able to assist a lot more seniors. Well, now that the COVID funding went away, the seniors didn't go anywhere. So they're trying to find funding elsewhere. So this is hopefully to fill that gap. House Bill 263. This bill came about to make the exploitation of elderly population people a specific crime, and it's now going to be punishable up to 10 years in prison and a fine of $10,000. So it's just to kind of, get more of a stringent, I guess, action for their
whatever they decide, however they want to split this in there, but, we kind of had an example, somebody was charged, I don't know if it was yesterday, in one of our community meetings, that somebody was being charged so much for an air conditioner, like 60-something thousand. Oh, my meetings are going, so I'm sorry, it wasn't this one. But, anyway, so those are the things that, that exploitation is gonna try and help us where we can have that, flexibility to, put more penalty charges on them. Also House Bill 460. This one is kind of, in with the House Bill 1, this was the 412,000, but it's an additional 400-something thousand, so in this House Bill 460, so it really makes the total combination 820,000. So, look, and hopefully I'll have more information on that at the next meeting. So those are the new initiatives that we have going on in our office, and that is all I have. So if you have any questions, I'd be happy. Eric?
I'm glad that y'all doing the pick up and go. And, do y'all have any deals with Wheels on Wheels?
So the Wheels on Wheels is a different program that's not really something that we monitor the council on aging to do, because it's not in our federal taxonomy. So it's not something that we look at, but each individual council operates on their own on the Meals on Wheels. So they can do it or they can't, it's up to them if they want to do it. So if they want to use their other funding, because some councils have local funding that they get, or they get donations from higher companies, they can utilize those funds for that. But we don't dictate them having to use that service or not. It's just up to them.
I heard that they was trying to stop the Wheels on Wheels. And where I stay in a community where disabled and elderly people be dependent on that type of stuff, because that might be the only mirror of the sea. And I'm totally as a board member that I wish that if they trying to stop that, they don't need to stop that, because a lot of people depend on that and depend on what y'all doing.
So they know if they're stopping it totally, or they're trying to find another mechanism to use other than Moms on Meals. Because some councils provide their own meals, like EDR, they're one of the biggest ones. They have their own kitchen, they cook their own meals, and they have their own staff deliver. They have truck, routes and the drivers do and deliver. So I don't know what parish you live in, but we can easily contact them and see if they're actually getting rid of the whole program, or if they're looking at an alternative way to provide that same service. Call me, email, either one, I'm looking.
Any other questions?
Every time.
One or two questions.
I wasn't paying attention. Why bills are y'all following?
Yes, ma'am. Let me open it again. Of course, House Bill 1, because we have a special allocation of funds. Well, House Bill 126.
Can you bring this for us?
126?
263.
Okay.
And 460. And if you look at them and have any questions, just email me. I'll help you.
Okay.
In the car.
I'm sitting on my email. But I can give you my email address.
I was gonna, well, Eric had no, later.
Okay.
Any other questions? Public comment?
You have any hand raised? Chelsea Adams?
Yes, Ms. Adams?
Hi everyone, this is Shosia M. Adams. This is in regards to the FSCR and
Some kind of, map or something?
Any other questions? Hearing none, the report requires no action and be placed on file. Now, the next item of business is the report from the LSU HSC Human Development Center. The chair recognizes Dr. Phil Wilson.
Thank you.
Thanks everyone, stimulating day so far. I want to start before I do my report, I just want to say that I will be retiring after almost 28 years come the end of February. And so most likely this will be my last council meeting, but we have another person that hopefully, because we're a ACL sister DD network sister agency, will come on as soon as the governor appoints, kind of thing. But it's been a great experience for me. I've gotten to know so many people over the last almost 3 decades here, and you know, you have to remind yourselves, those of you like Vivian who are on the other side of the future, is like you might get frustrated. Things aren't making the progress as fast as you'd like, but when you look back, that's when you actually see, you know, wow, a lot has happened.
You said shit.
With that said, I'm going to just make a couple of comments, and then I would like to go through a very brief PowerPoint with you all, and we'll have to do like the hand waving or something to go to the next slide kind of thing. But before I do that, I just want to say that you know, we were also grateful this past year to have received a grant from the council to do some FASD awareness raising with DCFS case managers and social workers. And FASD, I was waiting for somebody to whack me with the acronym, is fetal alcohol spectrum disorder. And it's, I won't go into details here, but I'll just say that it's an amazing thing. 1 in 20 first graders in the United States has a fetal alcohol spectrum disorder, and probably 1 in 1,000 of them have been diagnosed and given adequate and recommended treatment. A lot of these get confused as somebody that maybe has autism spectrum disorder. That's the most common thing, because many of the things that are experienced are similar, because it's a brain-based kind of disability. So I won't say any more now, but if you want to hear more about that, Dr. Kristen James is your person, and she was the one that did the work on the FASD, completed all, I think all but one or two community outreach kinds of things that we have planned, but I don't know what the next 2 months hold, because I'm not quite sure of that part of our contract. But so with that said, I just wanted, I was talking to a gentleman who's a self-advocate who went through Partners, who now is a full-time employee at the Human Development Center, Mr. Will Johnson. Many of you probably have met Will somewhere along the way. He came to me and he said, you know what, you can go to the next slide if you don't mind. You know, what's going on? I'm very confused, you know, and I have to say probably partly because he works at a USED, which, as some of you may be aware, has been defunded by the administration. I'm here to very happy to say that a lot of things that were quote unquote defunded are seemingly not dead yet. So the Senate today, the Health Committee met and they put the money back in their suggested budget. That still has to clear the Senate in a vote, and it also has to, you know, be not rejected by the House. So we still have a ways to go. But Will was very concerned because he hears a lot of social media, or talking to friends, or hearing all the people he works with, wondering if they have a job next year, that sort of thing. And so, next slide, please. Maybe, can you do the next slide? There we go. I don't know.
It just lagged, sorry.
That's okay. This is Will basically making his pitch to me. Now, this was then later videotaped, so it's a canned pitch. Not gonna play?
I don't think I'm gonna be able to play it.
That's fine. Let's go to the next slide.
I mean, I can try, but I think it's gonna come out of my computer and not out of the sound system.
Let's just go to the next slide. We'll make sure Will gets his. He got it. Oh.
It does have to. It has captions.
Oh, okay. Well, go ahead and play it. It's short and it's captioned. And I apologize if anyone has a visual impairment. scared about what's happening in the news? Are you worried about your supports and services and Medicaid? Well, I'm worried about all of those things. And I'm confused about what to do next. Because it's hard to find information that I can trust. So we need to advocate. But where do we go from here? Let's create a solution. Let's create let's go to our own event with clear information. So join us in creating this one-day summit called Speak Up, Stand Strong. An event where we can build our skills and build power. An event where we can inspire each other to use our voices together. I'm asking you, will you speak up and stand strong with us? Thank you. Okay, now we can go to the next slide. Oh, well, we've already talked. So again, just some of the questions that he was posing, cuts to Medicaid, and SNAP, and changes to Social Security, which I don't think there are any that are going to affect people directly right now. But that's part of the confusion. People could keep hearing different things, and some of them are real, and some of them are not real, and it's very confusing. So, next slide. There we go. So we aren't alone, and I realize it's a busy slide, but the question is to you guys and all the people that you know and so on and so forth, can we kind of pull something together between now and this fall to bring people, self-advocates primarily, maybe some family members, whatever, to an event where we can use plain language explanations of some of the things that people are concerned about or confused about or very afraid of happening, right? So if we were to do that, we wouldn't want, HTC doesn't really want to do this all on our own, but we will if it joins us. But I think it would be a better event if we could harness some of the power of, look, I don't know if you guys can see all the little letters on the thing there. I don't want to go through all that alphabet explaining, but basically, we have People First, and we have the SILC, and we have, the DD Council, and the USED, and the DRLA, and, different Families Up in Families, all kinds of organizations that we could pull together, the governor's office of disability affairs, to try to bring people to an event where we can help explain as best we can, and we might be, our friend Jeff from Medicaid or whoever it is may be there to, if we go forward with this, we're going to spend a lot of time the next 6 weeks contacting people with disabilities to find out what are their questions, what are they afraid of, concerned about, confused about, okay? Next slide. Will just like that slide. So, and Will is an amazing advocate. So that's injustice anywhere is a threat to justice everywhere. That's a Martin Luther King Jr. Quote. So one more slide, maybe two more. Oh, will you speak up? So, okay, keep going. There we go. Big unveil. Uh-oh. Come on, unveil now. There we go. So what do we want to do? Well, basically, what we're thinking is we had to put together something for this pitch to everyone here, but whatever is there is very malleable for whatever group of people coalesce around it, trying to put something together. But what we were basically thinking that we would spend a morning, like 9 to 12-ish, having people come and speak about whatever the concerns are that we can kind of identify as a group, right, from our self-advocates primarily. Then it would be a break for lunch. We can't buy lunch, but if we have a partner that can, we can't, even if we have a stack of lunch this high, we're not allowed to anymore, right? So that being said, we'll find a way to deal with lunch, but I don't know what it's gonna be just yet. But anyhow, the afternoon, what we want to do is work with those folks who attend, the self-advocates primarily, and family members, if they choose to also do this, is to help them create a video, a short 1 minute, 2 minute at the most video with a template that would be created by the planning group, helping them to say in their own words, what are the services that they depend on a regular, ongoing basis, that they're afraid may disappear or be reduced or, phased out, whatever. And if that were to happen, how would it impact them in terms of their daily life as well as their goals for their life, right? That would then be all packaged up nice for them to send to an elected official or a policymaker, maybe some of the people in this room, whomever, or maybe some of the bosses of some of the people in this room, to see the impact that these changes could have on Louisianans with disabilities. So that's kind of the plan. Is there one more slide or is that it? We have that's all right. Multitasking. Okay, so as I keep going, Chip, there we go. Hit the next one. We'll Ebony, can you send this to people, like anybody? Okay, great. And then, so we'll end it there because I know in the interest of time, there's a QR obviously there. If you, your organization, or any person or organization you're aware of, and you think, oh, they might, People First of Louisiana, they would be interested in this. And we'll probably hit some of the same people, but it's good to inundate people with stuff. They'll go to that QR, and there's like 5 or 6 questions they have to answer so that we can figure out, how to bring them into a planning. And that's all I got to say about that. So with that said, does anybody in the room feel like there's any feedback you can give me now to take back to the planning group?
Do you have any projected timeline of when this might happen, or?
We're thinking probably, we need some lead time just to, so that we're not inventing, what's scaring people out there or making them nervous. Of course. So we're thinking probably October. And I will say, I shared with Ebony and Melissa just a few minutes ago that Senate Health Committee met today on the budget, and they restored the USEDS back into the budget. But that's a committee. Full Senate has to approve it, and then, of course, the House has to. They have to do their reconciliation to make sure they agree. So what I'm saying is, for the USEDS, we may have dodged the bullet or not. We know we're good until June 30, and after that, we don't know. But what the Senate committee today was working on would cover fiscal year 26. So that would be, the next one. No, that's this year. But anyhow, 26, 27. That budget would come into play. So that's all I got.
Any other questions?
Oh, wait, does anybody else want to see any feedback or, I'm sorry. Get them back.
No. I think it's a great idea, but like you said, I guess we gotta figure out what the final answer is. And then we have to be able to digest it to make people feel more.
So I think that's why the timing, back to Liam's question, I think that has to get figured out. Like if this thing sails through and this budget bill is approved, and we all, we have regular government again before October 1st, then it would make sense to kind of move quickly. So maybe really a November, December is a more realistic deadline, because then we'll have more answers. But if we go into reconciliation, sort of nothing's going to happen for a long time. So I wouldn't want to push it past the holidays, I don't think. Unless it's real early in June.
Federal budget never gets passed.
It's rare, but this has been one bizarre administration. I mean, in terms of things I never thought would happen. So maybe no fast budget.
Okay, so, okay, in terms of the DDA. Yes, it's a digging the road, in terms of the DDA, if the usage gets amended, like, that doesn't, that not can be our federal law obsolete?
I mean, so we're all operating under the same federal law. We were all formed, as in the DD Council, the USEDS and the PNAs, the DRLA. We're all formed under that law.
Yeah.
But for whatever reason, this administration has, and been supported by the Supreme Court, by the way, as well, to say, okay, you have, as an executive, you have the right to fiddle with these things, even though they're in federal law. So we're in a very gray area on trying to figure that out.
So it's, because my question is, if the usage are out, then all the councils are not in DDS, like membership compliance, because DDS says we need the usage. So I guess I'm thinking to like big picture, people don't know.
Right, so I just think we don't know how that's gonna play out, and if that happens, then things will go to court, but once the Supreme Court is ruled, the only way to reverse that is through legislation. And that's, as you know, a long process. That would be another decade probably to get it reinstated. But let's not be gloom and doom here.
Yeah.
Let's try to say we can convince people to have a heart and do the right things and follow the law. But right now, I think we're all feeling like people have a lot of questions, and some of the answers may be scarier than not knowing, but I think people are always in a better place when they know at least what at this moment in time is the most logical response to what they're questioning.
Any other questions?
There is, one.
I'm sorry, who?
Frank.
Go ahead, Frank.
Right here today. Frank, we can't hear you. Can you unmute your computer?
One, I'd like to say who was it, the person before that was retiring. I'd like to say thank you to him and hopefully he enjoys his retirement. But also, I just wanted to say whoever made the rude comment before that, hopefully they can learn to be as tolerant as the rest of us. Whoever Zoom bombed us earlier.
Any other comments or questions? All right, thank you, Mr. Fields. Hearing none, the report requires no action and will be placed on file. The next item of business is the report from Louisiana Rehabilitation Services. The chair recognizes Ms. Melissa Bam for the report.
Thank you. So just kind of continuing a little bit on budget and legislation. So the last legislative session on the state side, LRS did receive an additional $4 million in state general funds. And that was directly related to the advocacy of people like yourself who went out to the legislature and testified on behalf of LRS. So we are very thankful. We did not get all the money that we needed to be fully funded, but we are headed in the right direction. We've been levelly funded for definitely over 7 years. I've been going 7 years as the director. So this is the first time we've got an increase in state general funds, so in that time period. So very thankful for that, and we're we're doing our due diligence to make sure that we show the legislature, that we are going to do positive things with the funds that they have entrusted to us, so that hopefully we will continue to get additional funds until we can get fully funded. But there are some, things that we are just watching out for in the federal budget that could, directly and indirectly, impact vocational rehabilitation. As Dr. Phil mentioned, nothing is set in stone with the federal budget, but there are some things that we do need to be mindful of when we look at our budget. The department, we're under the Department of Education at the federal level, so when the Department of Education put out their budget, there were some things that were eliminated or changed that that could impact our budget. So those things are the potential elimination of the supported employment grant. When people think of LRS, you're really mainly thinking about the vocational rehabilitation grant, because that's where the majority of our funds come from. But we do receive a $300,000 supported employment grant, and in the Department of Education budget, that's eliminated. Also, what's eliminated in that budget is the funding for the client assistance program, which is under disability rights of Louisiana. So in order to run a vocational rehabilitation program, you have to have a client assistance program, but they took the money out. So VR or vocational rehab will have to absorb those costs. So you've got 300,000 and around 150,000 potentially that will start to have to fund out of our VR budget that we did not have to fund before, if that comes to fruition. Other things in Department of Education that would affect LRS is a potential reduction in the Pell Grant, if you've heard about that. And then also the potential elimination of SCOG, which is a Supplemental Educational Opportunity Grant. So when our participants receive these federal grants, that's applied to their tuition before our application of funds. And so if there's a reduction in Pell and if there's an elimination of this SCOG grant, then we're going to be paying more in college tuition than we did before if those things are reduced or eliminated. And so that will have obviously a major impact to our budget because it'll increase our expenditures in those areas. So those are just some highlights in terms of the budget. Wanted to touch on the workforce side of House Bill 624. Brian talked about the LDH, the Department of Health impact of House Bill 624. But there's also a lot of changes that are coming to workforce because of this bill. The Louisiana Workforce Commission is actually being renamed and rebranded to Louisiana Works on October the 1st. So you will see a complete rebranding of the Workforce Commission to Louisiana Works. Also on October 1st, the workforce programs at the Department of Children and Family Services will be moving to Workforce or Louisiana Works. So that's like SNAP, ENT, just any of the programs related to employment at the Department of Children and Family Services will be moving to the newly formed Louisiana Works. Over the next 3 years, the TANF program, which is the Temporary Assistance for Needy Families, will be, that program, there was more wording on that one. I think there's some things that they have to do in order to move that program. So within the next 2 to 3 years, TANF will move to Louisiana Works as well. And this is all part of the one door approach. The whole intention of the bill is to help people in Louisiana go from dependence to independence. So the goal is to provide access to all services that people need in one place, and employment being a major piece of that to help people to reduce their need, the need for public assistance, but obviously providing them the public assistance while they are getting to the point where they can become independent. So you'll start seeing lots of changes, in the Louisiana Workforce Commission to Louisiana. The one aspect of that bill that also got changed, I'm not sure if I presented it here, disability determination, that at one point was going to be moved under LRS, but that's another program that is being moved to the Department of Health. So, we are still, there are still going to be efforts for us to collaborate better with that particular program, but it will be moving to the Department of Health, and we kept changing dates, so I'm not sure if that one's moving October 1st or next fiscal year. Also in terms of just funding and what we're doing because of the additional funds, we are trying to implement, or we're working with our Human Resources Department to present to civil service. We're trying to increase, it's called special entrance rate in civil service. We're trying to implement a special entrance rate for I'm trying not to use acronyms, for our rehabilitation counselor career progression group, to try to increase the number of applicants that we get for our rehabilitation counselor position. We currently have 23 vacancies. At least 11 of those are rehabilitation counselor positions. Brooke had asked about those earlier. We actually had a pretty robust discussion about that in our committee meeting on yesterday. Because as of right now, those are being advertised in civil service, but that's really the only type of advertisement that we have for that. And so I know a lot of groups in that meeting said that they would be willing to share our postings or share the information about that. So most of our positions should be closing on civil service, but next time we have some positions on there, I'll be sure to share that. So our vacancies can be shared as well. For our community rehabilitation programs, we did increase a lot of our rates. So that's on the second page. You'll see all of our different rate increases. The ones that I'll highlight for this group, job search assistant, the number of hours allowed increased from 20 hours to 40 hours. And support employment milestone 1, which is where we compensate vendors for job search assistance, increased from $1,000 to $2,000. And we also added $350 as a high quality indicator for placing in rural communities. We also, I've been doing CRP focus groups just in an effort to increase communication with our community rehab providers. We recognize that we have a lot of inconsistencies in LRS in many aspects. One being our career services and how those are implemented statewide, as well as some internal, how things are paid and all that great stuff. So we're trying to be more consistent. But we're also, we want to hear from vendors because we know we have challenges. We know our vendors have challenges. And so we want to know how we can work better together, because at the end of the day, we want to improve the quality of the outcomes, the employment outcomes for our individuals. And so that was our first step into just having discussions together to figure out how we can be more successful. We are also in the process of procuring a digital assistant technology platform called Sarah. So if any of you have received services from LRS recently, the communication definitely needs improvement, and we recognize that. We're significantly understaffed, but we don't want to continue. We want to be more efficient, and we want to be able to do whatever we can to give our counselors whatever tools that they can use so that they can spend more time with their customers. And so Sarah is, it's some technology that will allow virtual meetings. It will allow, it'll have an automatic scheduler on it, so, customers will be able to schedule, with their counselors without their counselors having to call them and talk to them, because that takes time from their actual appointments. It will allow customers to fill out forms, sign forms, submit documentation. They'll be able to actually submit documentation on their phone. So if they need to send us a receipt, for example, they can take a picture of the receipt and send it to Sarah. So hopefully it will allow customers better ways and more ways for them to communicate with us, so that we can make sure that we're not missing. For pre-employment transition services, the one thing I wanted to note here, we are working on some staffing contracts. Again, because of our staffing shortages, we want to try to find creative ways to be able to meet the needs of our individuals, even though we have staffing shortages. And so we are trying to pilot this in 4 regions. Region 1, which is New Orleans, 2, Baton Rouge, 7, which is Shreveport, and 8, which is Monroe. So far, we have commitments from 2 contractors. For Region 7, which is Shreveport, we will be contracting with Easter Seals. And with Region 1, we'll be contracting with Families Helping Families of Greater New Orleans. So we're very excited about those contracts that will basically do what our rehab the contracts will be for rehab counselors, and it will they will be providing those pre-ed services, meaning arranging services with the school districts, going to IEP meetings, taking the pre-ed applications, authorizing the pre-ed services, and making sure that they get connected to the full vocational rehabilitation program before they graduate. And we're hoping that those contracts will start October the 1st. Hopefully we can get them through the system. You'll also see at the back of the report, just the statistics that we typically provide for you. We did call this a end of the year report because it is the end of our program year, and so you can see the numbers there. But I'll be happy to take any questions or expound on anything. Any questions?
They're indicating and that, leaving a burn.
Okay. Adrian? Good. Have one more question. Have you noticed, like, with the students that are involved in the pre-ed program, have y'all tracking them, or the schools tracking them to see what are they doing after they're graduating, to see if that program is being successful?
We would only track the ones that actually end up in a VR case. Okay. I don't know that they're being tracked. I'm not sure.
Okay.
Oh, look, I don't know. Like, do you usually have a chart by the open and closed cases, specifically DD, apart from disabilities?
We changed this report a little bit,
You added
well,
pages.
I added a lot, so.
No,
What I did was, I had quarterly reports for so many different councils, and we combined them.
Okay.
And we tried to get the data that everybody needed, and everybody asked for. And no one's mentioned the closure data, so we may have taken that out, but apparently you wanted to, so.
No, no, I didn't. When did tell me, sure, one thing going for you.
No, you probably, that may have been there, but it's not there anymore. If it's
Okay.
something near and dear to your heart, just let me know.
On the chart, the
The
PET stands for pre-employment transition.
Yes,
I just wanted to-
yes, that is correct.
Any other questions or comments?
Just a pre-employment transition services is difficult because these PET needs, that they're only receiving pre-employment transition services, but some people receive pre-employment transition services in their VR case.
Any public comment? Hearing none, the report requires no action and will be placed on file. The next item of business is the report of the Office of Public Health. The chair recognizes Ms. Patty Maravecchio for the report.
So I'm going to report from the Bureau of Public Health. We are the Title V program for the state of Louisiana, and we sit within the Office of Public Health. For the sake, I'm in this very gold colored report, which is several pages long. We have a clinical side to the program, Children's Special Health Services, that have some remaining subspecialty clinics for children with special health care needs that meet legislative criteria in areas of the state where there's shortages. We also provide a children and youth with special health care needs transportation assistance program. Patients or families must apply first to Medicaid. Medicaid services must not be able to meet their transportation needs. And then they can apply for a transportation stipend. I think one of the biggest things we just completed, we are just like the council, we create a 5-year work plan, and every 5 years we conduct a statewide needs assessment for Title V. And so we just completed our needs assessment year. Our report went in on Friday. We do a report and then an application for the upcoming federal year, which starts in October. But there will be a strong emphasis in the next 5-year work plan on the pediatric medical home, because we know that children in youth with special health care needs and children who have access to a medical home are less likely to be hospitalized and necessarily are usually on their immunizations and are less likely to use the emergency room and just overall better health outcome. So there will be a big focus on improving access to pediatric medical homes. We do that through provider trainings, provider technical assistance. We have provider toolkits. And for families, we also have a family resource center. So if there's any needs of a family that they are trying to find resources in their community, they can reach out to our family resource center. It's manned Monday through Friday, 8 to 4. They can either email or phone. And providers, health providers as well, can make direct referrals or call if they need specific resources for their clinic. And here you can see our Family Resource Center also supports our birth defects surveillance system. So that the birth defects surveillance program is slightly up in the they refer, so any child identified with a birth defect in Louisiana is offered a needs assessment and resource and referral services from the Family Resource Center. So that collaboration really works to ensure that families can get access to the resources and supports at the earliest possible juncture. We also work with our Families Helping Families partners, and Phil, when you were talking about your program, I thought they were perfect partners for that work. But between our collaborations, we work with them. They do provider education events, which we call resource information workshops, and as those come up across the year, I'll announce them here. We also do the early hearing detection and intervention program, which does newborn hearing screens on the babies in the hospital. And then they have a follow-up algorithm that they try to meet federal guidelines. It was the 30, 60, 90 federal guidelines, which is by one, identified through hearing screening by 1 month of age, diagnosed by 3 months of age, and enrolled in early intervention by 6 months of age. If you want any information on these programs, I will be happy to connect you to those leads. But we also have 4 children who are deaf or hard of hearing and their families. They also have a Hands and Voices family peer support for this group, and the contact information is there. We also administer the genetic diseases program, which we do the newborn genetic screening in the hospital, as well as follow-up for any children with follow-up that require follow-up based on the screening results. I already mentioned our birth defects monitoring network. We do surveillance on the CDC's list of birth defects, and you can see all of the stats and the great work that program does. Also, under the Bureau of Family Health, we have the Louisiana Commission for the Deaf. They've been doing a lot of great work over the last couple of years. Whether it be training, they have developed a statewide mentorship program to elevate the quality and number of qualified American Sign Language interpreters in our state. And they've really been providing a lot of training and consultation so that we are truly accessible to that population. Our maternal and infant, we also have some home visiting. So if anybody wants information on the existing home visiting programs, we do parents as teachers, as well as nurse family partnership. There is at least one of those programs in every region of the state. And then last but not least, I'm going to talk about is the Louisiana provider consultation. This is a mental health consultation for pediatric patients. They also do a perinatal side, but for children with special health care needs, if any Louisiana health provider needs support, they can call and talk to a mental health consultant directly and get information, whether resources or guidance. If they need help with diagnosis or medication management, they'll be connected to a pediatric psychiatrist. We also have a data center on our website, which is Partners for Family Health. We publish a lot of reports. We do a child death review, we do our birth defects surveillance reports and such. So there's a lot of, for those of you who want to learn more about our pediatric population in the state, there's some good reports there. And as I mentioned, our block grant report just went in. And last but not least, we do receive funds from HRSA. We have an early childhood comprehensive systems grant that has been focused on the early childhood developmental health system in the state. And we've had great support from our partners around the state. And our Young Child Wellness Collaborative is a cross-agency advisory council for that work. And they're just releasing a strategic plan and a sustainability plan. They're starting year 5 of a 5-year grant tomorrow.
Any questions? Dr. Nangira? Any public comment? Hearing none, the report requires no action and be placed on file. The next item of business is the report from the Office of Citizens with Developmental Disabilities. The chair recognizes Ms. Julie Foster Hagan for the report.
Hey, Julie.
Sorry, Mr. Clark.
Yeah, I'm pinching for Julie. I'm trying to get out.
I was wondering.
Yeah, so it's the, I guess this is beige. Consider this beige. It's the beige document. It has a lot on it, but I'll try to get the hot point. So let me know if you're ready. All right, perfect. All right, so the first thing we'll talk about is this initiative we just wrapped up with some federal partners focusing on individuals with dual diagnosis, not dual diagnosis, sorry, individuals with dual eligibility. What that means is that they're both eligible for Medicaid and Medicare, and the individuals with IDD. That year-long technical assistance, focus on developing and implementing tools to increase knowledge of those particular, benefits that are available to people that are dual eligible. You might have heard of what's called like a special needs plan or a DSNP. That's specifically what we're talking about. So at the end of the project, we actually developed with the National Association of State Directors of Developmental Disability Services, a series of videos and toolkits that's available on their website that'll inform folks about the benefits and what exactly is a special needs plan and the benefits of having one or considering one. This is kind of super high. One of the benefits is if you're both Medicaid and Medicare eligible, usually you don't have Medicare because usually with Medicare, folks don't know, it carries a premium, meaning that you have to pay a certain portion monthly to use it. With some dual special need plans, they'll cover that premium for you so you can have Medicaid and Medicare. So that's one thing. And then there's benefits of Medicare, of course, expanded provider networks, expanded access to drugs and things of that sort. So please, if you get a second, I'll shoot Ebony the website for the National Association of Developmental Disability Directors website where you can go watch the videos. And there's actually a toolkit too, really informative. They have great background music in the video, very soothing. I watched them and they made fun of me because I was nodding to the jazz music, but it's great. So if you get a second, check that out. We talked about all the legislative stuff. So I'll kind of bounce around on the legislative portion. What I will talk about is the House Resolution 218. This is by Rep. Echols. This is a resolution that he's urging and requesting the department to look into another type of special needs plan. So this actually fits perfectly into what we were just talking about, dual eligibles. This plan is another dual eligible plan, but the criteria needed is different. I don't have a ton of information on it. That's why he's sending us to go study and learn about it. But once we do, it should benefit people who meet institutional level of care, are in the institution, or are likely to, or at any point in time would be in an institution like an ICF or a group home for more than 90 days. And this is another pathway and another way to get a special needs fund. What else we got over here? We talked about HB 559, that's the LGE bill. I won't kind of beat that up anymore. We all know what that's about. It's not, y'all already my urge for feedback. So we'll touch on that. We're not gonna talk about SNAP anymore. Love that. The ARPA update. So let's get to some stuff with this. So the ARPA is the American Rescue Plan Act. That is the plan, that is the act that was put in place during COVID. Just so you know, we had a spending plan where the federal government gave us a lump sum of money to assist in expanding and broadening home community-based services. We've been in this spending plan since I think 2022, if I'm not mistaken, but we just were granted an extension to continue to use these funds until September of 2026. Why is that important? One of the activities we have under there is our value-based payment program. You probably heard us talk about this at road shows. You heard it. Julie's probably shared it with y'all a bunch of times at TV Council. But the cool thing is that we're actually underway, and this allows us to kind of implement more of those incentives for a long period of time. Perfect example is the National Core Indicators Staff Stability Survey. What we did with one of our value-based payment programs is incentivize providers to complete this survey. What's the survey? This survey is to get a good lay of the land of the staff in Louisiana. Like, so the DSW, how much we're paying on average, what's our turnover rate, so on and so forth. Right now, we usually run right at the minimum amount needed, but our thought was if we can get more providers to complete the survey, we'll have a better representation of what our staffing looks like. in the state and compared to other states in the nation. So that, I feel like that's extremely important. For those who go to the legislature during session, they always ask, how much do we pay relative to other states? This report will help us better paint that picture for staff. So it's a little bit more about the incentives. So if you have a provider agency that you work with, we have until July 31st tomorrow. Well, today's the 31st. Today's the last day to do the survey. So if they haven't done the survey yet, if they're a provider agency that serve more than 200 people, they're missing out on $5,000. So we blasted it for the last month and a half. We haven't seen a huge uptick, just so they'll be able to do it next year because we got the extension, so that's good. But these providers always cry about, there's no providers in here, they always talk about staff and they staff. I was paying them money to do it, and we still haven't seen a huge uptick.
And I do it and get the money.
Alright, so that's that, so I'll move on. So another cool thing that we developed, over time was this employment toolkit. So I know there's a lot of people here that may receive services, and in the toolkit is important because it is geared toward providers and support coordinators, and it kind of lays out like, if you're interested in being employed or interested in doing pre-vocational things, and your long-term goal is to have independent employment, we laid out a bunch of different tools, documents that need to go into the plan of care, questionnaires that help with planning. If you get a second, go to the OCBD website, check it out. If you know someone that's receiving waiver services that do not receive employment services or pre-voc services, please direct them to this, because just because it's for the providers, it's formatted in a way so family members and recipients of waiver services can read up and be informed advocates when they're doing their plans and say, hey, listen, I know there's these services, I know what they're about, I think I may be a good fit for this, so instead of giving me this this personal care service for $8 a day, can I get some of this follow along with some of this supporting employment stuff? So if you get a second, check it out. Settings rule, we cleared all the hurdles, CMS have approved us, we're in compliance. You probably won't hear us talk about settings rule and meeting compliance anymore. We're probably just beat you over the head about making sure we continue to have folks in the integrated setting, right? So yay, that should be a clap. We're done with the settings rule. We're finally in compliance. There are only a handful of states that are in compliance, just so you know this is a big deal. Early steps, speaking of compliance, early step updates. We also have met the national standards per the Office for Special Education, how the P is from it, they're called OSEP. This is top, what is it?
Programs.
Programs, special education programs. So we are again found to be in compliance with the IDEA Part C federal regs in our early intervention program, which is early steps to continue to operate as it is, serving the people that we are serving. And I'll get into some numbers if we have time, but for the sake of time, I'll move to the next thing. So the money follows the person. This is our transition program. So we have people who are in institutions like NASCF that want to get out and want to receive waiver services. Money follows the person, assists with those transitions. They generally cover needs and things that you can't get covered through the waiver. We transitioned 32 people out so far this year, and that's across all our waiver types, which is now the road, the children's choice, and supports waiver. It's not in here, but most people that's coming out of the ICF probably won't need sports because they will need some one-on-one supports in the home that you can't get through support. So that's why it's not on there, but that's important. We did have another value-based program under MFP where we worked with support coordinators to improve their planning by providing person-centered planning, training, and certification and capacity building. We've paid out $600,000 in value-based payments across the support coordination agencies in Louisiana. So the goal is, and the hope is, that you will start seeing a better planning process, a more thoughtful support planning experience. And if you don't, I have another VBP incentive, which is a value-based payment incentive that involves a survey that's not on this thing, but I will be reaching out to advocates to help with us develop that support coordination survey, which will take a look at how effective it really is. Go to the next page. What's going on in Pinecrest? So we currently have 432 people in Pinecrest. We've had 24 admissions this calendar year, and we've had 10 discharges this calendar year. So we've had a net increase in residents at Pinecrest of 14 people. I think on that. Central Louisiana Supports and Services Center, that is 90, they're at 90. You see 4 admissions this year and 2 discharges. The reason it's so low, that's a very small and specialized facility. And they usually can't support that many people, but you know, it's usually more medically fragile folks. So that's why you see that. Another thing, our resource center. Most of you are probably familiar with them. This is our group of clinicians, allied professionals, and nurses, and dental hygienists, and all of that stuff that work for OCD, that their job is to help support the community to ensure that people can remain in the community. So a couple of things we want to focus on is the 952 individuals to date that have had some type of interaction with our resource center. And we've been able to successfully keep 95% of those folks in the community. So only 5% of that 950 actually ended up in the institution. And for one reason or another, it could have been something as simple as they may be older in age, it could have been a level of support that we can't get at home anymore, or they may have some kind of behavioral health crisis that they need to go spend a little time in the institution until they can be stabilized. But in any instance, our resource center does some amazing work, and it always here to support. The money. Well, first, before we get to the money, let's talk about the number of waiver slots. So if you look at the chart at the bottom, you see that since state fiscal year 23, we've increased the waiver count by almost 1,000 people. So that means that our most appropriate waiver process and our tail waiver system is working. We're not currently looking at increasing the waiting list, but topic for another day, you know, with some other things, you know, that's always looming in the background, potentially go back to the waiver. But right now, we seem to be fine. We look at average cost, which I'll talk about what's moving. Our average cost is actually ticking up. You see back in actually level, but it went down at 24, then went back up. But just keep in mind, we've done rate increases for providers. We've expanded services that have also been updated rates. So a lot of that average cost is related to some of those rate increases. And then when you look at the annual spend, again, we're up $30 million from last year, but a lot of that is tied to rate increases and that went to providers and some new service. And then that pretty state map down there is our population region. Anybody that wants to know. And then the last thing, I think this is the last thing. Nope, we got early stuff up. Spring of the urgency and need, right? This is the sun spring. This is part of the most appropriate waiver, you know, how we got rid of waiting list. So if you see, we're running about, what's that, 38% are urgent or emergent, meaning that of all the people who are requesting waiver services, 38% of those meet the urgent or emergent criteria, meaning that we issue waiver slots to them. And you'll see about 62% either have a need that's not urgent or doesn't need to be addressed in the next 180 days or more. So that's still ticking along. I know there's been some things about that, but hopefully that number that we are putting in a good clip of people requesting services, so that jobs. And then lastly, early steps. My favorite, mainly because it reports to me well, but this is the early intervention program. This is us catching kids early, so hopefully they don't need to wait, right? So if you look, we still support about 6,200 kids. We average about 1,000 referrals a month. Give them the good things about early steps, give a breakout of the actual usage of those folks on this document. There will be some changes coming to early steps, hopefully they are for the better. But more to come on that. That probably won't be till sometime late next year, but there will be changes. And with that, I'll take 10 minutes. Any questions?
Do y'all publish the trends anywhere, like, you know, like you were seeing 6212 down as far as 6126? Important to me because we do a developmental screening initiative that's hopefully pushing kids your way. And so do y'all, if you're anywhere on your sites that you publish the trends over time?
In this document, this quarterly document, I don't know if y'all noticed, you kind of switched the format.
Yeah.
Instead of making like ad hoc quarterly reports for the industry. So we switched to this a general quarterly reports, which I believe is published on the OCD site and can be pulled down. I don't have like an electronic version of the charts, but these numbers are there if you want to check when we update for it. Does that work?
Any other questions? There?
Yeah, it's about the Medicaid, I mean, not the Medicaid where you get both of them. Is it true that if a family member pass away and it be passed down to you, then you claim that, can they leave that for you to claim?
I don't have an answer there. I think you're talking about social security benefits.
Yes.
Oh, yeah, I don't have the answer to that. The only reason I knew what you're talking about is because it's totally off the subject. It's hard to get me. My dad died some years ago, and with that new executive order that went out late last year, where all these people started popping up using survival benefits, I think that's what you're talking about, the survival benefits. You would have to go through the Social Security Administration, and there's a website that walks you through everything to see if you can claim that. That's what you're talking about.
Yes, sir.
Yep. Windfall stuff. Yes, sir. Yes, sir.
That's a quick question back to the, sort of piggybacking on Patty's question. I think another, I don't know, I didn't, but if it's in there, but do you track or do you know if it is tracked the age that children who are being served under Part C or early steps are determined eligible to and then actually begin services? Because it's a program that goes away when you turn 3. So a lot of families I've talked to, you know, say, oh, you know, we didn't qualify till my kid was a month before his birthday, and it's like, you know, by the time you get, you know, so that is a metric that I think is as important as the total number of kids.
I do believe we do track as important. So 6 months before they're out of the early intervention program, we assess them to see if they would like or would be interested in, or if they have a need for waiver services. So we do have in our process that at that 6 month mark, that discussion begins to happen.
So 6 months from when they begin
6 months from
or 6 months from ending?
6 months from ending.
So I think the important number is what age are they when they begin to receive service?
Oh, as early as they're referred. We got some kids.
I understand that, but my question is, I don't think the state right now, or in the last 28 years, has done a great job of getting these kids when they're closer to birth than 3. You see what I'm saying? And just not poking at anybody, but documenting whether that is in fact an issue, or is that just a misconception? But so
it might be a little bit of both, but if I'm following you right, if you want the data of the people we serve or the referrals by age, we have that.
There's start data
to see how many are 0 to 1 are.
I want to know something slightly different, which is, because if I look at a snapshot in time, it's going to give me a whole bunch of ages, but I don't know if that child's been receiving services for a month or for 2 years and 3 days.
You can look at average living service.
Because I think that the amount of time that you receive services has a huge impact on how much you get from it.
Right, and we've seen an uptick in newborns and early kids with that. especially with I think it was a state law that went in the opioid.
They had the law where they required autism screening in pediatrics. They also had the perinatal depression screening in pediatrics. And then Medicaid also turned on billing codes to reimburse pediatric providers for conducting autism and developmental milestone screenings and perinatal depression screening. That was in 21.
So we've seen a huge uptick. Well, I'll definitely,
I just wondered if it was,
Yeah.
I could find it in the data or if that's something I
we
didn't.
probably have it. I just need to get those early steps already, and if we do, I'll shoot it to you. I'll shoot it to the group. So.
Yeah, that'd be good.
Lena?
Yes, are you discussing like the time from referral, when they receive the referral as to when the services actually start?
That's a whole nother issue. Because sometimes that's a long.
Of the kids we support, how long have they been screened?
Yeah.
From a parent experience, my son was in the NICU, so it took me a while to wrap my head around the services. Even though they offered it to me in the NICU, I didn't leave having done it. It took me a couple months to like get home and think, oh, we actually need this before I followed up with the referral and said to find the services. So I think there's a component too on parents that typically if you're leaving the hospital with a child that needs services at that young, your brain's all over the place by the time you get home.
Yeah, he does a lot, especially, I don't know if y'all know Kristen Tipton. Like, she works with the hospital social workers a lot. Identify kids, they have early on. And those social workers are aware about programs like early steps. And they route a lot of kids from children's hospitals to us and work with those parents and give that information.
Y'all been busy.
Any further comments? All right. Hearing none, the report requires no action and we place on file. The next item of business is a report from the Office of Aging and Adult Services. The chair recognizes Mr. Williams to present a report.
All right, thank you. Good afternoon. First, Medicaid Home and Community-Based Services update, which we just shared as normal, current number of recipients by program to the left there. As it relates to our waiver services and community choices waiver, I do want to highlight that that's FY 24, that should be FY 25 linkage to certification. We're still having linkage to certification. Previous quarter that reflect that's 56 days. You see there is 92. That is due to a larger number of linkages being evaluated. We've really been having our staff work closer, if that's support coordination, to evaluate those the backlog of cases. So we had that number increased to 92 days, up from the 56, because we have a longer pending. Those longer pending cases are now a part of the number that are being reviewed at Mr. Certification. The traumatic head and spinal cord injury, I think I mentioned before, we need to update that. So I make sure the next report is updated that now that legislation with that traumatic brain and spinal cord injury program, showing the number of cases there that are open and in the wait list for that program. I'd like to jump down to adult protective services. I think I touched on this in our last meeting. We've seen an uptick in the number of cases, continue to see the number of cases increase in referrals, increase in cases accepted, increase for adult protective services. The public awareness campaign has continued to benefit because we got to see that more citizens now recognize what abuse, neglect, and exploitation looks like. So through those social media and the billboards that we had around the state have continued to yield greater number of calls into the hotline for investigations of abuse and neglect. We're also working with DCFS because DCFS sees now where there are some cases where there are youth that are in DCFS's custody. that may be one turning 18 and exiting from their supervision. And they already have an idea that youth is at risk of abuse or neglect. And they are making a referral to APS where that kid is already on our radar before they leave BCFS supervision. Okay. Our task force, we're working on Senator Barrow extended the task force to get all of our discussions before, but also in that vein of adult reproductive services. We are seeing more and more cases of unlicensed group homes, living homes in communities and neighborhoods where there are multiple individuals living in these homes. For lack of a better term, there's a house manager that is really just collecting a social security or SSI check from these individuals that are living in these homes. And they're not really receiving any services, barely receiving the meals like they should be. So the task force that we are a part of is just that, to look at these homes, bring all stakeholders around the state to the table to discuss how we can address this situation, whether it be the fire marshal, whether it be local law enforcement, that will be coupled with our APS investigators that are going to these homes to look at these situations where abuse, neglect, exploitation are taking place. For the next page, just kind of gives our demographic information for the population that we serve. As Lenore alluded to earlier, the ARPA funds were set to expire in November of this calendar year. We were approved for the extension where the ARPA funding is going to be, the American Rescue Plan Act funding is going to be extended until September of 2026. So we are going to continue with training. You know, we always talk about the lack of staff or the service workers in the community. We feel that by establishing these trainings and a training portal for direct service workers, we have an impact on the number of workers that will be able to take advantage of the training and hopefully be a benefit to that community or workforce. So we're going to continue those trainings. We'll be able to extend that now. That's the American Rescue Plan. We are going to be hopefully completing the rate study, OES in conjunction with Medicaid and OCDE. We'll be conducting, but we're in the final stage of that. We'll be meeting here shortly within the next week or so to talk about the rate analysis of the rate study. And hopefully sometime by the end of August, we'll be able to have that completed, or we'll be able to compensate those providers based upon the information that came out of the study. We have one new support coordination agency that will be open. Forgive me, but I believe that's going to be in Region 6, Alexandria area. I'll have that information at the next meeting. If there's one thing I wanted to bring up on HCBS, the Home and Community Base, back to the community choices waiver. Of course, right now with the community choices waiver, it's first come, first served. We are in the midst of utilizing some American Rescue Plan Act funding to do a study of the current wait lists, as well as those that are currently receiving services, to kind of analyze if we can revamp our whole program based upon acuity, based upon need. Those greatest need being addressed first, rather than just looking at community choices waiver on a first come, first served basis. Okay. Any questions?
Any public comment? All right, hearing none, the report requires no action, be placed on file. At this time, we will have public comments. The public comments can be on any area of concern or question. Each person will be recognized by the chair and will have 3 minutes to speak. Any, Vivian?
Hi, so today we got the planning guide thing. It's really vague about everything. You like never get exactly like a specific definition for this. Yeah, everything, like for instance, it says no voting for personal gain. And part of it's to make it look like they're not being fair. What does that exactly mean? Because everyone's voting for their own personal reasons and have personal motivations. That's why we're all here. We all have very personal experiences. And then it also says, somewhere. Somewhere about not voting things in relation to like your friends and whatnot. How would we define friends for that? And then are like friends related to the council, okay, like friends that we made from here? Or is it talking about friends from like outside? How strict is this term being? Because that's a very subjective word.
Emily? Yeah, I can respond.
Okay.
So, Vivian, this is a plain language version of the policy that is included in the council's policy and procedures. So I kind of went in there in the orientation session 4 on each one of those things. So if you go to the email that I sent out with that particular presentation, it will go into a little bit more detail. I didn't record the sessions. If I did, you could have went back and watched it. But if you go to the policies and procedures manual, it's very confusing. And so I thought this would be an easier way to put it in a little bit more plain language, make it a little bit more accessible.
I appreciate the plain language, it's a little blurry because in particular, if you were to like strictly follow this, it wouldn't be good for self-advocates voting at all, and it makes it seem a little confusing on what exactly you can vote for and all. And that might cause concern, especially if someone does want to nitpick conflict of interest.
Well, yeah, I mean, I guess what the purpose of that is for is if you have a conflict of interest, you have to let that be known. I kind of went through that in the presentation that I did.
What would that be? Because this seems different from the ethics board's videos.
Most of the stuff that we have in our policy is from that presentation. If you have specific questions though, I can talk about it outside of this meeting because I know we're already like 16 minutes over. But I can kind of go over the policy with you. And if you have specific questions about the friend thing, we can kind of talk on that.
Any other comments? Brooke?
I would just like to address our Zoom call, and how we're gonna, I just want to know if we're gonna have something in effect for future meetings, for people that have public comment. I know we can't always like scream what they're gonna say, but if we could kind of figure out how to stop things like that from happening in future meetings. I just wanted to go on record and then try to figure something out.
I don't know, Brinson has his hand raised, people might want to.
So we've been trying to do some digging since it's happened to figure out what's going on, so we do know it's not a bot, it was actually a person. And so what we plan on doing is, once the Zoom call is over and we can pull the information, we're gonna be able to send that through IT and try to trace hopefully an IP address or something to figure out who this person was. I mean, they would have to do with that what they will, but then hopefully we could try to use that as a way to gauge if that individual will be trying to register again. It's not foolproof, but I mean, based on what I can tell from the way we have our Zoom stuff set up, it is very unlikely that someone can just hack in, like this was intentional, someone intentionally did this for whatever reason. Because you have to register, you have to get a passcode, you have to raise your hand, you have to put your name in the box, so this is not, it was an individual, so we're gonna try to figure out who that was. To the question of how you prevent it from happening, that I don't know. I think we could bring that to the to figure out if there are some processes that we can have in place. Also, we're having like a lag, just with the internet, we had it yesterday, we had it today, so it takes a little while, and even things like that, hopefully whenever we're in our building, we'll be able to do those things bigger, bigger. But we will be taking this off of YouTube, we'll scrub that section of YouTube, so there is gonna be a gap in the meeting, we're gonna take that out. I don't know if the transcriptionist was able to capture anything, but that is also gonna be taken out of the transcript, so we don't have that being. But we were gonna do some digging and find out who it was and see what actions we can take based on.
Okay, thank you. Vivian? Hi, so that didn't seem intentional on their part because remember, they raised their hand. The voice that first spoke was a woman's. And then it seems like she got cut off or interrupted because she like stopped speaking the moment like someone else started that. And it sounded more like a loop, such as like someone got stuck in a loop from Tourette's or maybe echolalia. If you've been around an autistic male, it sounds similar to either like echolalia or scripting or something like that, which doesn't make it right. But if the person, for instance, was in a melted down state or they saw something on TV and repeated it, that could have been what it was, and we have to keep that in mind because this is a council about disabilities and disability rights. So whoever was joining may have been a parent or a relative or a caregiver or whatnot. And we need to keep that in mind for in the future. It doesn't necessarily mean that your feelings aren't valid because they are very valid. And you have every right to feel the way you feel.
I want to know if you did it or was it connected to you?
Did what?
Had someone get on there?
No, why would I have had someone get on there?
I'm just asking.
No.
Okay.
Why would you ask that?
Just asking.
I would not have someone get on this.
Okay.
So I do think you hit it, Vivian. The person that was speaking surely sounded like a person that had Tourette's. And that's uncontrollable tip that people with Tourette's will say, usually they swear words or other inappropriate words. It's part of their disability. And so for that reason, Brendan, whenever the investigation occurs, I'm just encouraging you to take kind of the approach that if that was a tick for somebody, that means they had no more control over it than, I do when I sneeze. It just happened. Noticeable.
So how about what then? So like, I don't know if it's Anna, Stephanie or Brittany, whatever, but like, because I see what you're saying, Dr. Phil, but now that, like, hearing what everyone said, like, it did sound, it could go either way, but it sounded more like a bot and what she's thinking, like, but like when you heard whatever of you did like from your end on the Zoom. It did say like Miss Mary Smith has a comment and was a name that like we're familiar with.
No, the song, what was, I forgot the name.
Chelsea Adams.
Chelsea Adams, so it just said that Chelsea Adams had her hand raised. Long further, it wasn't a bot, but that's all we can tell them.
Okay. And I've never heard of say
Vivian, didn't we have someone like with that name or similar name speak prior? Like before that, I don't remember if it was yesterday or today, but I know I heard a voice, so I really don't think it's an intentional thing. Those sorts of phrases can be heard in video games or certain shows, maybe something from, or maybe even something someone said that they heard outside on the street. So maybe, alright. Excuse me. Yes, go ahead.
Because.
Yes.
At the end of this, whatever was going on, they doing what they gotta do, whatever's going on. Let's close this meeting. Everybody got to go, we've been here all day. Whatever's going on, let them have it. Now.
I'm just gonna take care of it.
I'm gonna say this, we as a board, this is a team. We here for one reason. And that's to handle this board. Now, this right here, it's time to go home. If I'm out playing ball, Terry, we've been here for a while, and we need to lead this right where it's at and let them deal.
Thank you, Mr. Well said. Thank you, everyone, for the comments, questions, and concerns. At this time, we will have announcements. We have 2 ad hoc committees that need volunteers. The Membership Ad Hoc Committee and the Legislative Advocacy Ad Hoc Committee. Please consider serving on either committee. Are there any volunteers or anyone interested? Let us know. Ebony or Brent, you can email them, me if you need to as well.
Yeah, I'll just send out a follow-up.
I volunteer for anything, everything.
Thank you, Vivian. All right.
I believe that the membership committee after October.
Well, Frank and Tony both had their hands raised, so I'm not sure if they can fill in.
I know for Tony, he might want to have, he might want to say something.
Tony? You're muted, Tony.
I'm mute. Y'all can hear me? Y'all can hear me?
Yeah.
Yes.
Going back to that unknown, obscene kind of thing.
No, we moving on, we moved on from that. We on,
That's okay.
Membership
That's okay, that's
Committee
okay.
and Legislative Advocacy.
No problem.
Thank you. Ebony, is there something else?
Yeah, can you guys please fill out your surveys that are in the back of your packet? You can just leave them on the tables and we'll go, pick them up. Please, if you guys, have acknowledged that you read the, policy.
Wait, y'all, we not finished yet. Hold on.
If you have read the conflict of interest policy and you understand it, you agree to it, please sign the acknowledgement form and turn it into Bridget in the back. And then I just wanted to tell Phil, thank you, for your service on the council. And we wish you both there.
There is no more business, and there is no objection.